and HealthTech Summit. On behalf of the TV9 Network and Visit Health, it is our privilege to welcome our distinguished guests, corporate leaders, HR visionaries, healthcare innovators, policymakers, and champions of well-being, really, isn't it?
Yes, कृष्णा, और ये समिट सिर्फ एक आयोजन नहीं है जो हम बंद कमरे के बीच में कर रहे हैं, बल्कि मुझे लगता है हम और आप और यहाँ पर मौजूद हमारे सभी स्पेशल गेस्ट इस पर विचार करने वाले हैं कि हमारे वर्क प्लेसेस कितनी तेजी से बदल रहे हैं और आगे इनका फ्यूचर कैसा होने वाला है, और हम सब एक कलेक्टिव मिशन के साथ इस ओर बढ़ेंगे। आज हम इस बात पर मंथन करने जा रहे हैं कि कैसे टेक्नोलॉजी और वेलनेस जो कभी सपोर्ट सिस्टम माने जाते थे, वो आज हर ऑर्गेनाइजेशंस की रियल ताकत बन चुके हैं और उन्हें रेजिलिएंट, ह्यूमेन और फ्यूचर रेडी बना रहे हैं।
Absolutely, and over the next few hours, you will hear from a senior minister who's shaping India's health and education roadmap. We're eagerly awaiting him. We also have global thought leaders triggering innovation across the board, and HR leaders building stronger and healthier workplaces. And with all of them, Priyanka ji, we will be delving into a range of issues, including how employee wellness has become a competitive advantage, really, for the companies. How health tech is strengthening resilience at scale, and how HR is becoming a strategic analytics-driven function, really. How India can create a healthier, happier, more productive workforce is what we are here for tonight. And tonight promises to be an inspiring evening full of learning, ideas and possibilities.
बिल्कुल कृष्णा, तो मैं और कृष्णा आप लोगों से बात करने वाले हैं, आप लोगों के आइडियाज को सुनने वाले हैं, अपने भी कुछ आइडियाज रखेंगे कृष्णा।
जी बिल्कुल।
ओके, लेकिन आगे बढ़े उससे पहले नजर डालते हैं कि इस पूरी जर्नी का क्या मकसद है। उसके लिए हमने आपके लिए एक छोटा सा वीडियो बनाया, सो लेट्स हैव अ लुक।
India stands at the cusp of a workforce revolution, powered by millions who build, innovate and shape the nation every day. But behind this momentum lies a pressing reality: rising stress, lifestyle diseases and burnout. Employee well-being has become the backbone of productivity, resilience and sustainable growth. And today, health tech is rewriting the rules of workforce care. Predictive, personalized, preventive. Visit Health is leading this transformation, unifying healthcare, technology and well-being into one seamless, intelligent ecosystem. And for years, TV9 Network has championed the nation's well-being, driving meaningful dialogues and placing health at the heart of national conversation. Today, this legacy continues as India's foremost leaders gather to redefine workplace wellness and health tech. Together, we shape workplaces that don't just perform, they heal, support and evolve. Welcome to the Visit Health presents TV9 Network Wellness and HealthTech Summit, where the future of workplace well-being is being written today.
Visit Health presents TV9 Network Wellness and HealthTech Summit, और अब समय हो गया है कृष्णा, I'm really looking forward आपके सेशन की तरफ हम बढ़ रहे हैं। बहुत ही इंटरेस्टिंग कॉन्वर्सेशन कृष्णा लेकर आने वाले कुछ खास मेहमानों से, और इसकी थीम है,
और उसका थीम है वेलनेस एज अ रिटेंशन टूल, द अल्टीमेट रिटेंशन टूल। क्योंकि आज के जमाने में जहाँ पे इंक्रीमेंट्स जिस हालात में है, वेलनेस का इंपॉर्टेंस शायद और ही बढ़ गया है। एंड देयर इज मोर अवेयरनेस टुडे अबाउट एवरीथिंग फ्रॉम physical wellness to mental wellness, and companies have the need and the responsibility if they want to both attract talent and retain talent. तो हमारे पैनलिस्ट से हम ये पूछने वाले हैं कि कैसे करना है।
बिल्कुल, आपने जो वर्ड कहा ना, मेंटल वेलबींग, ये बहुत इंपॉर्टेंट हो गया है, और स्पेशली मैं हमेशा फॉर द सेक ऑफ रिपीटिंग माई सेल्फ, मुझे हमेशा लगता है कि कोविड के पहले की एक दुनिया थी और कोविड के बाद की एक दुनिया है, जहां हमने मेंटल वेलबींग के बारे में अब बात करना शुरू कर दिया, हमारे कॉन्वर्सेशंस का हिस्सा हो रही हैं, और इस पर बात करना और इसे समझना बहुत जरूरी है कृष्णा। तो आपके पूरे इस पैनल में मेरे कान इस बात पर टिकी रहेगी कि मेंटल वेलबींग को लेकर ऑर्गेनाइजेशंस क्या कर रही हैं। देखिए, वेलबींग ही है अल्टीमेट रिटेंशन टूल जो हम समझना चाहते हैं।
और ये भी पूछना चाहूंगा कि हाउ डज अ कंपनी बैलेंस when they have to answer to the board and they have to answer to the employees, because both are equally important. So there are costs involved in having long-term wellness programs. How do you really strike the balance? And that is going to be very important, because at the end of the day, you need to have a profitable business to even talk about the other things over there. So, you know.
So I think your panelists should be aware that you're going to be asking some tough questions, huh?
Not tough really, but trying to understand this, because we are all over here taking time out from our regular lives to come here and have this evening. So the conversation better be something that we would listen to if we are sitting alone with our phones, looking at some YouTube videos, trying to get some knowledge and wisdom from all of that. Instead of that, you're all over here with your phones on silent mode. Thank you so much for that. And so that's the reason why this conversation is going to be something that you would usually watch in a podcast or any one of those videos on YouTube. So we're going to have it as interestingly as possible.
So Krishna, please. Go ahead. So Krishna is on stage with his eminent panelist, and हम समझने वाले हैं कि कैसे employee well-being जो है एक ultimate retention tool बन सकता है. Over to you, Krishna. Okay, so Krishna is getting ready. Thank you so much. जैसा कृष्णा ने कहा, आप लोगों ने phone off कर लिया है और अपने आप को present कर लीजिए इस conversation का हिस्सा बनिए.
I think the mic is on over here, so we can get proceedings underway. So let's get all the context in first. That's the most important thing. In the recent years, workplace well-being really has transformed from it's good to have, add-on kind of a component to, a core part of employee retention and engagement, really. Employees today expect organizations to care for them holistically, with access to preventive care, mental wellness support, telemedicine, OPD benefits, and of course, digital first solutions. And this panel is going to explore what triggered this shift, which kind of wellness interventions deliver real impact, how organizations measure the ROI or return on investment of well-being programs, and what the future of employee care really looks like. And to do that, we have a very special set of panelists joining us. I'm going to begin by inviting Mr. Sanjay Singh, Executive Vice President and Head, Compensation and Benefits at Aditya Birla Capital. Huge round of applause for Mr. Sanjay Singh. Mr. Uday Karthikeyan, Managing Director, India, Chegg Inc. Huge round of applause for Mr. Uday S. Karthikeyan. Mr. Anish Keskar, Vice President, HR, HDFC Asset Management Company. Mr. Anish Keskar, thank you so much for being with us. Huge round of applause for Mr. Anish Keskar. And finally, Mr. Musarat Hussain, Head HR, Suzuki R&D Center, India. Huge round of applause for Mr. Musarat Hussain. Thank you so much for all of you for taking time out to be over here. This is a very important conversation. The only thing I'm having an issue with right at the outset is that, retention tool. I think it's time that you stop looking at wellness as a retention tool, isn't it? Can we have his mic on?
You want to go right there. Have you heard of the concept of a warm-up?
Warm-up?
Anyway, here's the thing. I hesitate to define or put boundaries around wellness. And the reason for that is, to my mind, wellness is a catch-all. It's a set of behaviors that drive meaningful change and that helps you be the best version of yourself at work and in life. So when you give it that broad a perspective, thinking about it in terms purely of retention or a method to get to retention defeats the purpose. So I know retention is an important measure of success for programs. The boards ask for it all the time. And there are quantitative ways to talk about that. But fundamentally, I think about wellness as doing the right thing, not just for the employees, but for the organization overall. And when you start from there, you basically do a design thinking, grounds up approach to creating a program that works. So my measurements are not necessarily retention, but more around NPS, around access, around ubiquity, and technology.
I was just trying to get to the heart of the matter right at the beginning. That's the reason why I came with you for that. Mr. Keskar, if I were to ask you, how does a company go about doing it? That's my second big question. It's now known that it's a necessity. This is not optional, and it's not a perk that gets offered. This is basically as important as giving salary to employees. In that context, and at a time when costs are under so much pressure, how does a company strike the balance, and what are the ways of doing it?
Okay, so here is my take on this. I have never seen an exit checklist which lists burnout as a reason why the employee left. I have never seen. It's been 20 years. I have never come across a checklist where one of the options, apart from better career opportunity, more money, different role, was burnout. Similarly, I have been in many discussions over the years. Until recently, 4 or 5 years back, nobody ever discussed the word wellness. And this is 20 years. Now, wellness has become important because there are 4 primary stresses that we deal with. Every one of us here struggles with the same 4 things: workload, time, money, relationships. These are our 4 struggles. Everyone here, including me, including you. It is completely irrespective of how much money you have, how much experience you have, how many friends you have, how powerful you are. We all struggle. We have the same struggle. And when it comes to younger employees who are most likely in a location away from their home, it's even worse. So giving them access to wellness through health tech is no longer an option, it's a necessity. According to me, health tech and wellness, sorry, I come from the asset management space,
That
so
is
wealth tech comes
in a way.
comes much more easily to the tongue, is occupying the same space as occupational health and safety occupied 20 years ago. Both are equally important, number one. When you have a young workforce away from home and they are anxious about something and they want to speak to somebody at 10 in the night, if they can talk to somebody, reach out to somebody, or if they have any medical issues, 50% of the calls that we get on visit roughly deal with, in one way or the other, orthopedic issues or mental health. Nobody really calls saying, okay, I have a stomach upset. Somebody obviously is in pain, motivated enough to call. And having somebody intervene at that point in time is extremely helpful. So it's about access and about giving a friction-free experience, which makes it very, very important.
Right. Mr. Hussain, he was talking about how wellness, the word wellness came about 5 years ago, not before that. But you've been privy to some great employee wellness programs growing up yourself. Some of the biggest companies in the country give some of the best wellness programs to their employees.
Yeah, so good evening, everyone. So we were discussing before the event. So basically, let me tell you, the health tech and all these things post-pandemic have actually become very, very critical. But if we go back, I remember my childhood. My dad worked for Tata and then ICI. We had nothing to worry about health, medical benefits or anything. It was all free of cost given by the company. So we grew up without even bothering about health or wellness because we were in a beautiful place, nothing to worry about, health issues, everything taken care. But the moment I graduated and then moved on to a metro city, we had no knowledge. We negotiated, we did not even know how to negotiate about salaries. But let me tell you, what I have seen getting evolved now is that when I hire my people for my GCC in Pune, they talk about how much work from home you are giving, what are the wellness benefits you are giving us, what are your insurance policies, which health tech you are using. And these are the certain questions for the last, I have an experience of 38 years. In my last 32, 34 years, nobody had asked me this question, even in the final interview. Today they are asking all this. So this is the transition which has happened, but in larger public sector or large organization, these were already there. But the mental health issues, post-corona issues which has emerged, but the challenge of a metro city is totally different. Here you have traffic issues, you have issues of stress, elongated, stress timeline, lifestyle issues, you have peer pressure, you have FOMO, fear of missing out, all kind of challenges are there, and the mental health issues we never even heard about 10 years back. No, and it was taboo, actually it was taboo, it was there, nobody talked about. Today they talk about it. Today it is very much there, nobody shies about talking about these things. We have seen in Corona, the isolation when youngsters got stuck in their home and they went through trauma and all those. Now these are something which is evolving, and I think it is just like Zomato or Swiggy. It's instant, you are ordering help, you can get medicine, you can get all those. So this transition we are seeing, and I think it is fantastic actually.
It is fantastic, Mr. Sanjay Singh. The fact of the matter is that now wellness is not just about the traditional medical insurance policy, the Mediclaim, whenever you get hospitalized. It's about things that happen that can be done without having to get hospitalized and use the Mediclaim policy in the first place, isn't it?
Absolutely. So when we talk about the hospitalization insurance, it's a very important and essential benefit to have, but the frequency, if we look at, is not very regular because events may come like not very regularly in a person's life. OPD insurance, for example, and all other wellness programs, it's very real, it's very quick, and at the same time, employee can realize it like in a very tangible way. A study I recently have gone through, about 75% of the entire medical cost a person incurs is toward the OPD, your medicines and diagnostic test. And actually your hospitalization cost only accounts for some 20%, 20-25% odd. That's why it's a very important to have all this ecosystem in place, and it's very helpful.
Can I add something on
Yeah,
this?
please go ahead.
See, on this point, let me tell you, as an employee, let me tell you, we were getting 15,000 benefit for your health check, or not health check, rather medicines and OPD and things like that. It was okay 10, 15 years back, you could manage in 15,000. But as the health cost went up, we realized that the OPD cost is going high, and our cost of medicine or routine pathological test, it is too much to, and there was nothing like OPD insurance and all. And actually we have gone through that period. So I know the benefit today when this thing is there and there is no capping like 15,000. It is phenomenal.
Okay. Uday, if I were to ask you, how do you do the checking? Because what I'm trying to understand is how do you ascertain ROI on wellness programs? Because that will sort of, be able to put the numbers clearly for you as to how far you can go and how much you can go.
Yeah, so it actually is very simple. Now, one of the advantages of being at CHEG is we're a relatively young organization. The average age is about 30, give or take, which essentially means it's a very tech-native workforce. So for us to be able to, for me to be able to go back to the board and say, here's the amount of money we want to spend on a wellness program, and I make it a point to remind the board that traditional insurance plans, they have a really important use, but they're on the wrong side of wellness. They come in when things have already gone wrong. What's critical is to be on the right side of wellness and to demonstrate that year on year, and I do this very simple equation, which is year on year I'm showing a reduction in premiums on the traditional plans offset by an increase not just in productivity, but also in the amount of absenteeism. When that equation goes to the board and they start to see that I'm spending about 30 cents for every dollar of premium paid in the traditional plans, it sells itself. So this is not a hard job when you think about it along those lines. But to take off on what Hussain said, I think the critical element of the ecosystem we find ourselves in is technology. It allows us to scale. It allows us the freedom to be cost effective. And that's part of what our work with Visit has been over a couple of years now. And without that ecosystem, without the underpinning of technology and the ability to access services regardless of geographic limitations, makes it possible, to his point, of just doing away with cost caps and programs that limit availability.
How do you do it, Mr. Keska?
Our considerations are different. We have employees across 260 locations, many of them who are very young, and most of them have left their homes, taken our offer letter, joined us, and are representing the brand. So it's not a question of ROI, it's a question of making sure that they have access to what people in the larger cities have.
If I were to ask you the same question, Mr. Sanjay Singh?
Yeah, so my take would be, first of all, wellness is not a cost.
Okay.
So
there is no question of ROI, you're saying?
No, so it's an investment.
Okay.
And ROI, I think my friend Mr. Keskar knows it very well, the entire ROI as a concept. But when we talk about it's both qualitative and quantitative in that sense, if you're trying to really measure that, the entire ROI thing. Retention being the obvious one, because we can see the reduction in cost of hiring, etc., which really translate to that. But retention is a lag measure, we all have to remember. And really we need to see the lead indicators. Like ENPS, my fellow panelists talked about, that's one way of looking at it. Another way is the engagement survey, and I can give a very personal example here. In one of the companies, we launched the OPD insurance scheme, and in that year itself, our scores on all engagement surveys were 10-point plus, which was not there before in any of the years in the last 10 years. So that is the kind of impact it has.
Mr. Hussain, the thought here is that how do we do this going forward? It's evolved, it's reached a stage now where it's a necessity, it's a salary, equivalent to a salary. How do you see it evolving in terms of having integrated wellness platforms where, you're not, healthcare benefits are not provided in a fragmented way. Every company needs to have that integrated platform where wellness benefits from physical to mental, from OPD to hospitalization, everything is given.
Yeah, let me first come to the fundamentals. See, you are talking from only white-collared Gen Z or other kind of people. But when you look at manufacturing where you have contract labor, you have gig worker, you have supervisors, blue-collared workers, many of them would not be tech savvy. So the traditional system will also coexist. So people talk a lot about that EV will replace all the vehicle. Let me tell you, they will all coexist. Now, coming to the medical also, this health-tech and all will be very good for white-collar, the young generations. And even in white-collar, people in my age group, right? People in my age group would still prefer, let me tell you, for example, I was just talking to somebody that I have the app with me, I never use it. Because I know the doctors, I just pick up a call and I say I'm coming. Now the young generation will go through the app, book their OPD, this. So what I'm trying to say is that the mobile usage has gone up. Let me tell you, mobile usage has gone up, users are going up. The even blue-collared are becoming tech-savvy. So slowly transition will happen there, but still there will be a large chunk of people who are contractual, outsourced, people who are working at the ground level. We have to take care of all. So we have to coexist.
Okay, Uday, first, do you concur with that view? Second is that when I said integrated wellness platforms, I didn't mean a technology platform. I just mean the fact that the wellness benefits need to be integrated and go and come through one source. It's not like the employer has to go somewhere else to get his Mediclaim benefits and go somewhere else to get his mental health counseling.
I agree. I think one of the oversights that we often make is the generational nuance of rolling out programs. So to his point, I think there is a very real need for a variety of systems. And that's why when I started, I said I'm not defining wellness and health tech. The future, to my mind, is one where I'm able to hyper-personalize a benefits program that works for me as an individual, not as a cohort, not as a executive or as a 35-year-old or a 50-year-old, but to me as an individual. So based on the stage of life I find myself in, my lifestyle, my lifestyle choices and the consequences of those choices, to be able to pick and choose a series of things. For instance, at the age of 23, I might want health insurance, but I actually need several other things on the right side of wellness which really help me shape up and be the human being that I want to be. Mental wellness, for that instance. 55 plus, there are certain policies that are worthless and some others that mean a lot. So when I say technology is important, it's important because that is what is going to enable the hyper-personalization. But that cannot come at the cost of ignoring folks that are not tech-savvy or that don't have access to technology. Because there are parts of the country, and we work with a lot of NGO partners in some of these areas, there are parts of the country where there isn't internet. They haven't seen a phone. I'm not talking about a mobile phone. They haven't seen a phone. It's in the middle of a jungle. So, get programs
plantation
there.
Or mines, you don't have, and there are lakhs of workers working there. How do you reach them? So it's a transition. It will go to metros, tier 1, tier 2.
Okay, Mr. Keska, please go ahead.
See, the government of India thankfully has made a very nice addition to the Occupational Health and Safety Code this year, where above a certain age, I believe it's 40, you have to offer annual health checkups as an employer. Now, it is a very welcome move because this opens the gate to a lot of people being eligible, being aware, and being offered this as their right. It is legislated now. And just the simple fact that this has been legislated for the first time in the country will lead to a lot of integration of platforms on its own. I think it's eventually just the fact that, the state has woken up and has legislated it will lead to a lot of integration across platforms.
Mr. Sanjay Singh, you want to come in?
Yeah, my take was a little different here. In one of the companies, we rolled out the telemedicine and really worked well with the manufacturing locations, which was really on a faraway remote areas. Because the quality healthcare is a challenge in remote locations. And also the specialist doctors are not available. If I give a very specific example. So entire tech platform and tech enablement really help people to get access to specialist advices. I think it worked really well for us. Second, whether in the future everything will come on one single platform, I see we are still a few miles away from that. And one reason is in India we don't have composite insurance licenses so far. So we have multiple service providers giving different benefits. And if at all we bring everything onto one platform, employees' experience differ a lot. If we really talk about health or OPD and all that. So this is one thing maybe in future, not in the near future though.
Okay, not in the near future. If I were to ask you, we keep talking about Viksit Bharat 2047. How do you see this by the time we hit the year 2047?
I'll not be alive by that time. But anyway, let me visualize that Viksit Bharat. I think
we wish you are, sir.
Internet penetration will be very, very high. And I'm sure that the way we are evolving, I'm sure that especially in the space of wellness, but like when you create a software, there is always a virus which comes. And then you create an antivirus. This has been going on for a long time. So I'm sure by 2047, there will be many more challenges in terms of health and all. And I'm sure these technologies, you never know.
More health challenges than the one that we have right now.
Yeah, you had corona. Did you visualize you can have corona too also?
Exactly why I'm saying.
You never know what is happening. So, but these technology is going to actually make things easier for everyone. And I'm sure by that time, you don't say that disease will go. Disease have been there for lakhs of years.
Technology, in this case, is both a facilitator and a disruptor of health. We've seen the fact that, usage of social media affecting mental health levels and so many questions being asked about it. And right now, we have to, again, strike the balance when it comes to the technology as well as the access to your employees. If that dreaded word called retention tool, if you want to retain employees, if you want to retain talent, then you've got to be able to allow them the right to switch off, like the bill that has just been introduced.
And that is a very important point, because a lot of this is going to have to be legislated. I think the government has a very important role to play here, because it's going to be impossible for individual employees, groups of employees for that matter, to want this from their organizations. Organizational interests are significantly entrenched. So legislation is critical. The right to disconnect is one. I think I am in love with the Australian law that prevents access to social media, Instagram, up to the age of 16. I think some of that is very critical, but that cannot come at the cost of technology evolving to meet people where they are. So it's a tricky balance to get. But I want to be contrarian to your 2047 Viksit Bharat point. I think for India to get there, we need to get to a place where wellness and health technology catch up to where people are and what they need well before that date. Because given the environment we live in, the lifestyle choices we make.
Now, before you go any further, the question I asked you was that how do you envision all that's changed, in terms of wellness and health for employees in the last 5 years? How do you see it shaping up? How would you like to see it shaping up by the year 2047, when we are that Viksit Bharat?
I mean,
what is the ideal scenario?
The ideal scenario to me is unrestricted, ubiquitous access to healthcare, whether that's driven by technology or traditional medicine. And more importantly, healthcare that is affordable for everyone underpins the success of any economy. That's going to drive us to that very ambitious goal that each one of us want to get to, actually.
Mr. Keskar, you wanted to comment on that? Your vision. By the year 2047, how do you see whatever has changed in the last 5 years finally taking shape? Or how would you like to see it taking shape?
I mean, there's a lot of things going on. I mean, Aadhaar 2.0 might come along.
I meant in terms of just health and wellness for employees.
I'm just kidding. You see changes happening in documentation of health issues, prescriptions, etc. Blockchain technology is being introduced. There are simply too many things in the mix for us to, kindly make a forecast. You have the Prime Minister's insurance plan. So many things going on. You have states which provide health and wellness insurance nowadays.
Yeah.
So it's too difficult to look that far ahead.
I'm curious because, for example, something like as basic as a provident fund, or for that matter, Mediclaim, it took a while before we got there.
Yeah.
Isn't it? It took a long time before we got there and made it as part of salary. Now wellness and health is part of salary.
Yeah.
So if we are sitting here at the threshold of 2026, 20 saal baad,
Very difficult to predict anything. There are simply too many things in the equation.
okay, you can comment on that.
I can add. See, first of all, we believe talking about anything beyond 6 months is like going in the domain of astrology nowadays. So 2047, although is a very important year, not only because 100 years of independence it will complete, it is also the year when our planners project that the population is going to plateau, the entire population growth, and it will start declining from that year if we continue by the current pace. It will have a lot of impact on the social infrastructure and health and wellness space that we are talking about. So for example, I don't think flexible working would be like an offering by the organization. It might be regulated. Entire idea and definition of employee and the organization and the office or workplace will all change. So that's certainly we see all those things happening.
All right, listen, since you tried so hard, let me try and paint a picture, right? We've done a...
Just trying to be a crystal ball gazer, man.
Yeah, let me try paint a picture for you. Here's how I'd like to experience health tech in about 10 years.
Go for it.
I've got a wearable that is able to monitor not just the key metrics of health. It does a lot today, but say without pricks, monitor blood sugar. Without pricks, continuously monitor oxygenation, heart rate, all of your primary matrices. Be able to scan and test for genetic markers or critical illnesses. For an AI model to then summarize all of that and send it off to my doctor. For it to schedule a consult based on his availability. For me to be able to choose to go in person, video call, phone call, whatever the method of consult is. For the doctor to then be able to do a thorough but equally robust assessment of where my health is and what specific tests he'd like me to conduct. For that same app with agentic AI to be able to schedule those consults, get me to a place where I'm now focused on preventative care every day of the week rather than a once in a year legislated exercise of that my employer has been mandated to do today. Is that Da Vinci level or are we getting close?
All I could think of while you were talking was that Steven Spielberg film called Minority Report, where you have, artificial intelligence predicting a crime before it happens, and then you sort of, reach there just in time,
Yeah. So I think it should not be on a lighter side that we have such high tech that they predict that you are going to die in 48 hours or you are going to have a heart attack. So AI should not go to that level that it happened, very simply. I tell people that when calculator came, we lost the ability to calculate actually. So it is like that. So for example, for the health, we'll not look at the body signal, but we'll wait for variables to tell us something is wrong. It should not. So, that ability should be retained.
Well, one way or the other, it's not in our control anymore, isn't it, in terms of what's going to evolve and how people are going to adapt to. We wish we did not have smartphones, but we have smartphones, and it's going to be with us for a very long time. It's going to evolve probably into something else. I don't know, but that we're going to be looking at screens for a very, very long time to come, isn't it, Mr. Keskar? So, keeping that in mind, certain things are going to be, like you're saying, so many things are going to change. Like you're saying, 6 months is too much, so things are going to change very fast. But screens are going to remain. Lifestyle diseases, lifestyle issues are going to remain the same. Jobs are going to be tight. Timings are going to be tight. We've seen that transition. Those, 9-to-5 jobs are history right now. Even employees don't want 9-to-5 jobs. They want it in the hours that they are comfortable with in the first place. In that kind of a scenario, what would be your top 3, how do I put it, tippany to companies dealing with the health and wellness challenge? How do you think they should go about it, considering this is going to be our future?
Well, first of all, consider health and wellness as something which is universal, not limited to one segment of the population. Offer it equally to everybody. That's the first thing I would say. Give equal access. Second is, use technology or personalization to a fair extent, because needs at 50 might be different from needs at 20. And third is that look at wellness with the same seriousness that people look at occupational health and safety. That's about it.
Okay, that's very simple, but as I said, equal access, big words. It's easier said than done. And look at it as a necessity, easier said than done. Mrs. Sanjay Singh, I was asking these questions because these are questions that companies are asking themselves. And today, it's not just about going out and hiring left, right, and center. It's about hiring the right talent for the right position. So it's every employee, there's so much of a cost involved in acquiring that employee. And then there's a cost involved in retaining that employee, because, once that employee leaves because your wellness program ain't up to scratch, it's going to go into another loop all over again, isn't it? So, and that's the reason why I'm asking that, how do you do it in the near future? I don't want to ask you 2047. How do you do it now? If you have a new financial year coming up in the next 3 months.
Absolutely.
That is less than your 6-month timeline.
Yeah, exactly. It's less than 6 months. So retention, of course, that is one. But I think it's an important goal, but not the ultimate goal, so to say. Ultimate goal is about capturing the commitment of employees. And to my mind, that happens when there is a point from where the employee starts putting in its discretionary efforts. Mumbai Taj attack 26/11, I think, is the best example. Employees sacrificed their lives trying to save their guest. It was not coming out of any template of job description or the role description or their KRAs and so on and so forth. How to get that? I think that is the real challenge before the organization. So retention as well as the commitment, these two have to come hand in hand.
Well, I'm going to come back to you because, I just realized, you're an American multinational. Not that I realize it now, but because I'm asking this, because in the US, the quality of health benefits and dental can really define an employee's choice of organization, because dental is very expensive in the US. The fact that you give that as compulsory along with salary makes a big difference. That's like, that can be the line ball call where, the employee takes whether to go to an organization or not. How do you see that, working out in India? Because the parameters don't match. Dental is not as expensive in India as it is in the US. But there will be, what do you think should be the ideal package, if I may? Not the salary package, we will leave that to every single employee, but the wellness package that you think should be that, salary plus.
Without getting into the murky world of HSAs, because it's every leader's nightmare. I'm going to give you a contrarian take on this. Let's not go so far as saying acquisition or retention is going to be underpinned by or dependent on the kind of wellness programs you offer. I think salary far and away outweighs any other consideration by employees today, regardless of where in the world. And
I'm just asking, like, going in the future.
Yeah, I'm getting there. I promise. There is a road that leads to the answer you're seeking. No, but it goes back to what we opened the conversation with, which is being able to personalize what compensation means for individuals. In the future, I should be able to take a certain amount of money for my expenses, be able to allocate everything else that's a cost to the company, but that's passed on to me as an individual, and pick and choose what's important to me. I might have terrible teeth. I actually have terrible teeth. Don't get 6 feet or closer. But for me, dental is going to be critical. And I want the ability to look at compensation holistically and say, if it's going to cost you $250,000, and we do this at Chegg today, if it's going to cost me $250,000 to hire you in the Bay Area, how are we going to spend those $250,000 to make sense to you? We do that today, but we do it in a very fragmented way. It's kind of like having a conversation, hoping you get meaningful answers, and putting a program together around that. I spoke to Sunil about this some time ago, actually, when he first pitched this product to me, which is, I said, yeah, right there. I said to him, the day you get me to a place where an app like Visit can take a look at my compensation and give me options to plug together what makes sense to me, I get to a place where I have the ultimate retention tool, because that is compensation for you as a person. Doesn't have anything to do with the second guy sitting next to you or any of your colleagues in the organization. So that's how I think about it in the near future. And I'm saying months, not even years. That's where I'd love to get to.
I have a nice contrarian analogy as you were talking. You were talking about health over here. So it's basically, health benefits like a McDonald's order. Burgers plus fries plus Coke, or burgers plus fries plus a sundae or a milkshake, as the case may be. The customizable wellness benefits is what you're getting at, Mr. Hussain. We are having this conversation where, again, this is not about extremely in the future, in the near future. And that flexibility is what employees are going to be looking for, isn't it? That's what he painted a picture of, is what the employees are going to come and ask. Okay, this is the salary, I'm fine with it. What are your welfare benefits options that I can choose from?
So, see, as of now, there are certain options which is there. There is nothing to choose. These are all offering by the company. And these are not part of the compensation. When we negotiate with candidate, we negotiate on the annual total remuneration or CTC. These are all add-on. These are all value adds to the whole package. And to me, these are all hygiene. I mean, it has to be there. I think I am not going to negotiate that I am going to give you these insurance or these health tech tool or blah, blah, blah. These are all there. I mean, these are certain things. I mean, in fact, earlier when even canteen or cafeteria used to be there, it used to have a subsidized kind of a thing. Today, it is all free, of course. It is there. So these are all packaged. There is nothing to negotiate. It's the employer's job to add on more value adds and give the best to their employees.
Mr. Keska, that's a fair point, isn't it? It's I just, one way of looking at it is that it's the employees has to give a suite, like a health and wellness suite of benefits that along with the salary. And the quality of that suite needs to improve. It can't be one or two things.
Well, looking at the future, I really do not know. I mean, it might turn out that all the employee wanted was GLP-1 to be added to the list of things he's eligible for. And probably the way it is going, it can take care of a lot many other things.
You're saying the fact that the way the jobs themselves exist right now,
yeah.
Salary is like, thank you very much, is it?
Yeah, so I mean, just add GLP to my list of reimbursements.
Mr. Sanjay Singh, that's a very bleak approach to the future.
See, I would say I'm a big fan of government organizations and PSUs. And it really, I wonder sometime that why people stay there for all their lives. Do they really pay more than what the private sector pays? If not, then is the salary really that important? So it's finally what I have seen, salary brings you to the organization, but your wellness and your entire benefits make you stay.
That was hitting the nail on the head, isn't it? Because otherwise, if there are no jobs, then people are going to go do some other occupation. But they're certainly not going to come to you, for sure, isn't it? Because the nature of jobs are changing. We're like getting into a greater and greater gig economy as we speak. So, if jobs are coming down, the willingness to go to a job is also coming down. So, this is a catch-22 of a situation, isn't it, Uday?
It isn't actually. It's pretty simple. I mean, let's assume that the future of work is gig work. For argument's sake, it's not going to be, but let's assume that that's the case. Even at that point, I make a certain amount of money. Now, the organization may or may not provide me with a suite of benefits at that point. But for me to be able to access those suite of services myself by using a portion of the income I make becomes critical. So no matter how you slice and dice this, there isn't a scenario today or in the future where health and wellness does not matter. That's a given. Now, how you choose to deploy it is going to depend on your individual circumstances. But let you in on a secret. If none of this works, try food, free food.
Free food.
Yeah, because here's Cheg's success story, right? One of the things that people didn't realize is our cafeteria system, where we did the traditional thing, wasn't really delivering results. But what we then did is, I went and talked to a couple of folks at Zomato. And from there, we got the idea of creating our own version of Zomato, where you only get healthy food today. So every employee goes on the Chegg food app that morning and orders what they want to eat from a series of healthy choice restaurants. That gets added to our wellness portfolio, and it costs us like $300 a day on average. No, not serious money at all. So I think just start to maybe do free food, and people stay around longer.
Now, at the beginning of this conversation, I told you that you will definitely learn something from this conversation. These are like health and wellness hacks, ladies and gentlemen, for all those watching. That's, if you're thinking of what are the strategies for employee attraction and retention, there you have it. It's one of the simplest ones you can definitely add on to it. And I really hope all those in this auditorium at least are going to add on to it. But I'm afraid we're completely out of time over here. Ladies and gentlemen, huge round of applause for the panelists, who have really helped us understand where we are and where we are going. Thank you so much. Before we let all of you go, let's quickly have a photo opportunity so that we can get ready for the next session as well. So requesting all the chairs to be put.
Thank you so much, gentlemen. Thank you so much for this interesting and engaging conversation. And Krishna, I think you've learned a few tricks, as you said, few hacks, how to retain your employee. And what I picked up was what over here our panelist, Uday, was talking about, hyper-personalization. Because हम जब बात करते हैं, जब तक आप पर्सनलाइज नहीं करेंगे चीज़ों को, लेकिन यहीं पर बैलेंसिंग एक्ट प्ले करना होगा. हाइपर पर्सनलाइज भी करना है, लेकिन सबको उसमें हिस्सा भी बनाना है.
जैसे हम बैलेंसिंग एक्ट कर रहे हैं हिंदी और इंग्लिश के बीच में.
आपकी हिंदी बहुत अच्छी है वैसे. आई एम सरप्राइज.
धन्यवाद.
आपके एनर्जी लेवल से मुझे मैच करने में दिक्कत हो रही है, पर आपकी हिंदी बिल्कुल मुझसे मैच कर रही है, कृष्णा.
You are very kind. You're very kind. But yeah, so now that I told you what I was looking for. It's look at the come out of conversation around wellness and mental wellness. Clearly, that is the new add-on, because I think companies are still trying to figure out how do you, deliver that benefit for mental wellness. Do you help with counselors? Do you help with consultation? How do you do it? Is there somebody for counseling at whatever time an employee wants? Those are questions that we raised.
And it's an investment.
Exactly. Mr. Sanjay Singh said it's not a cost. Don't look at it as a cost, because once you say cost, you want to cut it. Because the moment you say cost today, it means cut. So don't think of it as cost. Think of it as investment. So, and with that, Priyanka, I think it's time to move on to the next session.
Now we are heading for our next conversation. वो भी बहुत interesting होने वाली है. तो हमारी अगली conversation focus करने वाली है re-engineering workforce resilience through health tech. And I would like to welcome Mr. Sunil Srivastav, Chief Business Officer of Visit Health, to join us on stage, जिनसे हम समझने वाले हैं कि modern organizations में health tech की भूमिका क्या है, जिस पर एक बहुत अच्छे conversation को हमने देखा. Now we're moving on to our next conversation. Krishna, over to you. A big round of applause for Krishna and for Mr. Sunil.
Thank you. Okay, Sunil, before I go any further, let me first introduce the man on the stage. As you rightly heard, he is the Chief Business Officer of Visit. Also, more importantly, he's been with the company since almost since its inception. So he's an extended founding team member. And he's got a nice roster, to talk about. Before we go any further, just to give you a context, he's been somebody who's been with some of the biggest brands. He's been an executive director with Xerox. He's been a director of HR with Whirlpool. He's been with Cadbury's. I can go on. It's been quite a journey, over 2 decades of corporate HR experience. It's incredible. Huge round of applause for Mr. Sunil, over here. I'm going to begin by asking, first of all, talk to us about your journey with Visit Health. How has it evolved from where you began to now?
Okay. Thank you, Krishna. my journey, one thing that I can say is that I've grayed more hair in the last 10 years, right? Since I joined the company. I've been there since inception, as you said. And I've spent more than 2 decades in corporate HR. Well, I've been on the other side of the fence, right? And hired, you know, health wellness partners and insurers and so on. But I remember that that time, of course, primary care and OPD and all were non-existent. I'm talking about many, many years back. Anyways, so health tech was emerging. I would still say it was emerging 10 years back. And there were hardly any players. And then I came across, and I actually individually wanted to be associated in health tech space. It was, and fortunately, I had an opportunity to meet Vaibhav, Anurag, Chetan, and Shashwat from Visit. They had already built a platform. They just graduated from BITS Pilani. And they were looking for someone who could, because it's B2B platform, looking for someone who could place the platform in corporates. So I came from HR. This comes under HR domain. So I had an ability to go through penetrate the corporate space. So I came on board and joined the team. I remember that we were still just 10 people organization. And we were sitting in the office of MapMy India, which had seed funded us. And we just had a row of chairs with us. And if I look at, I take a leap and look at today, I'm sitting in this August gathering, right? Partnering with TV India, right? And so we've reached that stage, right? And from 10 people, we have become almost 900 folks today. And so we really grown very fast and very quick. I still remember that how did we acquire few first clients. And I really thank some friends in corporates who really reposed faith in us, in our platform, in our company. And we were fortunate to start with some big brands right from the beginning, right? From, I would say, day one, right? And for example, Times Group, Times of India, I remember. And
of course.
Avery Dennison, Kohler, Tata Metallics, SDFC, AMC, Anish is sitting here, right? And quite a few corporates. And we had won these accounts in few months, including AkzoNobel and so on. So we were fortunate also. But what I feel is that I think they saw some confidence in us as a team. And they possibly thought what we were doing could be of value to them as well. Because nobody does charity as such, right? So, but they did see the value. And we started the growth engine for our company from there. And of course, we were growing leaps and bounds. And the real growth, of course, came around COVID time and so on. And a very critical part of our business is building the network of service providers. Diagnostic centers, hospitals, clinics, doctors. Right, I still remember we celebrated when we had the first 1,000 cashless, doctors on our network, our own network, right? Because now today we have more than 75,000, wow. Right? So it's been a journey, and what we are doing today, right? So certainly from 500 clinic hospitals to more than 22,000 today. Right, and we cover 9,000 pin codes, and we are top of the heap today, I would say. I mean, I'm not saying this out of arrogance, but it's a fact, right? And we are top of the heap, and I'm saying stakeholders in the ecosystem are keen to work with us. And of course, it's in our interest as well, right? Okay. And we have done integrations with all these stakeholders. We have built our own AI tool and so on. So we've built in a lot of efficiencies. And we were possibly the first company in the health tech space who had launched the first very disruptive cashless OPD program. Right? So I think it's been a very eventful and meaningful journey for for the organization.
Okay.
So that's how it's been. I think it's been an interesting journey.
Okay, so you're talking about OPD. I wanted to ask you, why is suddenly OPD and primary care become the centerpiece of, health and wellness for an organization? How is it exactly a smart investment for every company?
I think, let me say this, Krishna. I would say hospitalization is an event.
Like this one?
Yeah. And primary care and OPD is a journey.
Okay.
Right? And if you really look at it, 70% of the healthcare happens in this journey.
In OPD?
In OPD. I mean, this space, I would say, the healthcare. Because hospitalization is something which doesn't happen so often, right? So, I mean, I was just gathering some data. I mean, in India, the annual OPD spend is in excess of rupees 4 lakh crores, right? And out of a total healthcare spend of more than 10 lakh crores or so, right? And it's been, so I think OPD is gaining a lot of traction.
Right.
And what is happening is that, if you really look at it, OPD touches the lives 7 to 10 times more than the event that happens, that is the hospitalization, right? And still today, even today, many organizations are still investing more in ensuring the event, hospitalization, right? But yes, of course, there's been an awakening and more organizations are now investing in OPD and primary care as well, right? And if you really look at youth, if you really look at it, the chronic diseases, the age has dropped to 45, less than 40 years of age. 20% of the population in the age group of 40-45, they suffer from chronic diseases, right? 1 out of every 5 heart attacks.
20%, that's a scary number.
Yeah, absolutely. And 1 out of 5 heart attacks happen in this age group, less than 45-40. This is a scary time. So it's now the time that one has to invest in OPD space, right? So that it doesn't become an escalated situation, right? So, I mean, delayed OPD care is very expensive from mental health perspective as well as financial perspective. I mean, you will be surprised to know a preventive care spend in 10 years would be about 3.5 lakh rupees. And for curative or escalated care would be more than 25 lakh rupees in the same period, right? And it's mentally and financially draining for the individual, right? So it's being recognized now. So it's gaining traction. Our corporates are losing millions and billions of dollars because of delayed OPD care. Today, corporates lose $15 to $20 billion every year because of this, right? And this fact is again getting recognition, right? I mean, 20% of disengaged workforce can lead to 20% of payroll cost. So I think it is high time. I mean, OPD is not looked at as a perk now any longer. I would say it's looked at more as a productivity tool, right? And it's because if you really look at it now, the impact is being assessed from data perspective also. It is said that it can lead to 20% lesser attrition or 15% lesser absenteeism, right? And it can lead to even a reduction in hospitalization insurance cost.
Right.
Right? Because today, absenteeism and presentism, I'll tell you, it means unwell people working, at workplaces.
So they technically check box the fact that they are at work, but there is no productivity.
Yeah, absolutely, right? So I think all these facts, if you really look at these facts, so hospitalization is a safety net.
Yeah.
And OPD is, I would say, a retention asset, right? Or an happiness quotient asset, right? So that's how it's being looked at now today.
Okay, tell us, what kind of unique value does Visit Health offer to employees? some of the biggest companies that you've worked with. You know, they're all there with you because you offer something unique. Can you tell us about it better?
Well, I think we add a lot of value to overall health and wellness ecosystem, right? And see, we are not just a health benefits provider. I would say that we provide a complete ecosystem on a single platform for primary care, right? Which is based on depth, which is based on data and daily engagement. And I would say that, see, what is happening is we have a very robust network of service providers or OPD network integrated on a platform, right? Whether it's clinics, neighborhood clinics, hospitals, diagnostic centers, or doctors, right? I was just saying a while ago, we celebrated first 1,000 cashless. We are possibly the largest cashless OPD network owner in the country today.
Wow.
Right? And, you know, and along with it, I mean, the diagnostics, as I mentioned, you know, what we are doing today is more than 2 million teleconsultations in a year. Right?
Ladies and gentlemen, huge round of applause for that. It's 2 million plus consultations.
And we are doing approximately 3 million health checks in a year, right? And we are doing about 500,000 OPD consultations in a year, right? So all this data, if you look at it, and we also are able to provide a lot of value through longitudinal data, right? Which is around the risk cohorts, you know, disease risk cohorts, or lifestyle trends,
right,
or medication patterns, right? And or even on mental or physical health quotient and so on, right? So what we also try to do is, from preventive care perspective, we are able to assess the risk, say for example at diabetes, on diabetes 2 years hence, rather than 2 days before when the person collapses, right? So all this kind of, and this is all through our own predictive model, through AI and, you know, data analytics that we do, right? All of it leads to it. And, you know, we have a very robust platform, which is a complete you know, well integrated platform for complete primary care. You know, we have it's under one single umbrella, right? And you know, there's something or the other available for every profile in the organization, because everybody is not falling sick. You know, it's a beautiful blend of preventive and curative care, right? And so what do I do if I'm not sick, right? Whether it's about nutrition management or it's about whatever it could be, or physical wellness or mental wellness, you know, everything's integrated on a single platform. I'll give you an example how some basic, because we don't have much time,
okay,
some basic things around how technology or AI that we have built, the tools, how it's helping the corporate users. So we have also developed our own AI therapist, right? For conversation with AI-backed therapist, not talking to a human, and you know, get a complete guidance and have a conversation, right? And get a complete guidance.
Right.
We'll of course move to voice-based also. It's right, not text-based. And smart health reports, for example. So when I get my health check done, it's AI-backed, and I get a complete summary instantly on my red lines, greens, and, you know, complete of what are the vulnerabilities that I may have. So there's a complete summary immediately available, which I can carry to my doctor as well.
Right.
Right? And there's an in-house tool that we have developed. I call it Maori. That's what we call it. This is for claim adjudication. Through this tool, we have been able to improve our turnaround time by almost 93%, right? Because the tool is able to read the prescription, right? Whether it belongs to the employee or to the family member, which manually was done by the doctors, right? And similarly, a tool is able to read for adjudication claim, the claim which is submitted for reimbursement and so on, whether it is as per the policy or not. Inclusion, exclusion are there in the policy. Tool is able to read that further validation, adjudication. So, all these things are happening. And so that's what I can go on, but we don't have.
Incredible things are happening. That is literally reshaping the way health and wellness exists in India. As we speak, we have companies like Visit Health reshaping health and wellness and health tech as well, with more and more innovations in technology. The moment you said AI therapist, I just really hope that people stop using ChatGPT for it, because there's a clear directive against it. But there's really genuine AI solutions, for health and wellness. I'm afraid you're right. We're completely out of time.
Because, our AI tool absorbs very comprehensive data that we have, the knowledge base that we have.
Fair enough, fair enough.
Because we have enough data with us now.
Exactly what I'm saying. More and more innovations like
because
that.
remember, we have 10 million lives on the platform, right? We
Absolutely.
have millions of active users, right? So we are able to actually generate a lot of valid data.
Absolutely. Wishing you the very best and more innovations that can drive other innovations in other companies as well. Ladies and gentlemen, huge round of applause for Mr. Sunil Srivastava. Thank you so much, sir, for sharing some of those insights of what technology really can do. Before we let go of you, we need to have a photo op, and then we will let go of you.
Thank you, gentlemen, for that engaging conversation. So here we are with, evening is progressing. Krishna, and how are you feeling?
Well, it's been back-to-back me, so I really am waiting for your discussion. We're just waiting for you to hear, because I think even the audience has had a little bit too much double dose of me back-to-back. So before they start having a problem with my voice, I'm just going to let people know that the next session is definitely not me. This is going to be held by Priyanka Sambhav.
Thank you, Krishna. Finally, my turn is coming after Krishna has finished some of very engaging conversation. I think what Sunil was talking about, OPD as tool, it has sort of become such a central point when we talk about well-being, well-being, or whenever there was a conversation on health, it was all about insurance. But now OPD is taking the center stage.
It goes back to the old adage, Hindi, Angrezi mein kahavat hai ki prevention is better than cure. So, if we are really, when it comes to wellness, we've really reached that stage where, yes, great, we'll pay for your cure. That exists. That's not going away anywhere. There will be that Mediclaim policy. There will be that insurance. But that's not, we really hope you don't have to use your Mediclaim policy. So we will do enough to ensure the fact that you don't have to use your insurance policy.
और जो उन्होंने cost बताया कि अगर आप OPD में जा करके शायद 3-3.5 लाख का खर्चा कर रहे हैं, अगर वो नहीं करेंगे, तो इलाज के लिए आपके कॉस्ट जो है वो 25 लाख 30 लाख के पास जा रही होगी। ये आंकड़े चौंकाने वाले हैं, और मुझे लगता है प्रिवेंशन इज बेटर देन क्योर यहीं पर हो जाता है कि ओपीडी अब हमारे ऑर्गेनाइजेशंस का इतना इंपॉर्टेंट पार्ट बन रही है, क्योंकि बनना ही पड़ेगा। पैसे बचाने हैं, साथ में एक ओवरऑल वेलबीइंग की फीलिंग आपको अपने एम्प्लॉय को देनी है। तो
Yeah, I just want to add one more point to it. We're talking about mental health and all that. Now, the levels of mental health also define the levels of your physical health. We've realized that recently that stress can really take everything away no matter what you do. And that is the reason why we're trying to understand the transformation of workplaces through health tech and wellness. Our next session, our next panel discussion, it will be on that. And in this session, we will discuss how the fusion of AI and health tech and wellness and others define the future of work models. And of course, without any further ado,
thank you, Krishna.
Priyanka, the floor is all yours.
थैंक यू सो मच हमारे साथ बने रहने के लिए। और आज हम एक ऐसे नए माहौल में काम कर रहे हैं जहाँ AI driven HR systems, predictive analytics, digital care platform और hybrid work models organizations के काम करने के तरीके को पूरी तरह से बदल रहे हैं, और इस बदलाव को लीड कर रहे हैं कंपनी के HR लीडर्स। और आज हम उनसे ही समझने वाले हैं कि उनका फोकस कहाँ है, वो टेक्नोलॉजी का इस्तेमाल कैसे कर रहे हैं। और इस बातचीत में मेरे साथ एक बहुत ही खास पैनल जुड़ रहा है, तो लेट्स वेलकम देम ऑल। सबसे पहले आई वुड लाइक टू इनवाइट भावना बत्रा, वाइस प्रेसिडेंट पीपल एट S&P Global. So Bhavna is a seasoned HR leader with over 2 decades of experience across global organizations. A big hand for Bhavna Batra. My next guest is Sipika Singhal. She is Vice President, India Total Rewards, EXL. And she has been working very closely on how to sort of work out the compensation benefits, rewards, design them around people. A big hand for Sipika. My next guest is Anil Pulakappa. Though he told me I should call him Anil. So Anil, please come to stage if you're here. And Anil is a specialist in total rewards and employee well-being with deep expertise in designing integrated compensation and wellness framework. Let's all welcome Anil with a big hand. Last but not the least, I have with me Uttam Lal, Director Personnel, NHPC. Welcome, sir. Welcome to this platform. Uttam Lal brings over 35 years of HR leadership experience across India's energy sector. As Director Personnel at NHPC, he has driven people, strategy, industrial relation, and CSR initiative. And when I spoke to him, he was like, I'm going to come and tell you, Priyanka, how we are benefiting our employees. So let's start with you, Mr. Lal. Yes, why not? So let's start with you. And I want to understand, जिस तरह से AI अब चीज़ों को ड्राइव कर रही है, एक फियर तो है लोगों में कि भाई AI आएगी और मेरी नौकरी चली जाएगी, लेकिन AI से फायदे भी बहुत हैं और मुझे लगता है ये आप लोग और आपकी इंडस्ट्री इस पर काम कर रही है. तो आप लोग कैसे AI का इस्तेमाल कर रहे हैं अपने एम्प्लॉय की वेलबींग के लिए और आपने क्या बदलाव देखा है ओवर द इयर्स?
धन्यवाद प्रियंका. Thanks to the TV9 for giving me an opportunity to share my companies. मैं अपनी कंपनी के बारे में थोड़ा आप लोगों को बता दूं because मेरा प्रोडक्ट तो सबके पास में, आपके जेब में भी बिजली चल रही है जो बड़ी चंचल है, संभल के रहिएगा. बट द कंपनी, हम पहाड़ों पे रहते हैं. NHPC is on border areas. You name the border, I am there. J&K, I am there. Chinese border is on Siang and Arunachal. हम वहाँ बैठे हुए हैं because we require a head. आपका वो ग्रेविटी के फोर्स से हाइड्रो पावर जनरेट होता है, बट हम 100% रिन्यूएबल कंपनी है. हमारा पूरा पावर ग्रीन पावर है. बट वी फेस चैलेंजेस, द क्लाइमेटिक चेंजेस, एज यू सेड हम ग्लोफ फेस करते हैं. अब यू सेड द AI. जनरली वी यूज़ AI इन मोस्टली इन टेक्नोलॉजिकल एडवांसमेंट. लाइक हमारा अर्ली वार्निंग सिस्टम है. मैं एक छोटा सा स्टोरी आप लोगों को बता देता हूँ. आप लोग सब ने देखा होगा कि 2023, if I remember exactly, because वो बड़ा, it was a very troublesome day for us. Not the day, night, रात के 12 बजे ग्लोफ आया था सिक्किम में. And 23 हमारे आर्मी के जवान शहीद हो गए थे. The last man, एक महीने बाद उसकी बॉडी मिली थी. I hope you remember. And there was a complete washed out of 1200 megawatts Sikkim, that is called तीस्ता 3. तीस्ता नदी पे भूपेन हजारिका का गाना है ना, तीस्ता नदी से तू चंचला, तो बड़ी चंचल नदी है वो. उस पे हमारा डैम है 540 मेगावाट्स का. एवरीथिंग वॉश्ड आउट एंड एवरीथिंग, द कंप्लीट मक एंड सब हमारे डैम में आके फंस गया. बट हमारे डैम ने नीचे में जो डाउन स्ट्रीम पूरा बचा लिया. बट अभी तक डैम हमारा क्लीन नहीं हो रहा है बिकॉज उसमें बम्स हैं, रॉकेट्स हैं, चाइना बॉर्डर का जो था. बट हमारे 23 जवान चले गए. हमारा EWS हमने लगा के रखा हुआ था. वी कैन नॉट प्रोटेक्ट, वी कैन नॉट स्टॉप द ग्लोफ. ग्लोफ आप लोग जानते होंगे, दैट इज ग्लेशियल लेक आउटबर्स्ट फ्लड. उसमें हमको सिर्फ 32 मिनट का टाइम मिला था. ओनली 32 मिनट. जैसे वो आपका चकदे में बोलता है ना 90 मिनट है आपके पास, हमारे पास सिर्फ 32 मिनट थे. दैट 32 मिनट्स में हमने अपने 1000 कंस्ट्रक्शन के वर्कर को बचा लिया. 3 जगह हमने टीम डिवाइड की. मतलब आई वॉज नॉट देयर, आई वॉज डायरेक्टर ओवर हियर, बट माई HR टीम एंड दी HOP within 32 minutes they have divided 3 teams. एक चला गया against on the left bank of the river, the other one is on the right bank of the river. में मिक्स चलेगा ना हिंदी इंग्लिश, क्योंकि भाषा दिल्ली में यही चलती है अपनी. तो और फाइनली जो 1000 जो हमारे लेबर्स थे जो कि बिल्कुल बैंक पे रहते थे, कभी सोचा ही नहीं था कि ऐसा होगा. 100 साल में ऐसा नहीं हुआ था. हजारों को उठा लिया गया. एक हमारा लाइफ लॉस हो गया क्योंकि जनरली पैनिक में ना कुछ लोग भागते हैं.
तो आप लोग का काम जो है डिफिकल्ट टेरेन में भी है, बहुत डिफिकल्ट टेरेन में. और यहाँ टेक्नोलॉजी आपके लिए बहुत मददगार
टेक्नोलॉजी बहुत मदद करती है. अब आप जैसे अगर मैं कहूँ, आप लोग शायद सुने हो या ना सुने हो, किशन गंगा सुने हो, किश्तवाड़ जरूर सुना होगा आप लोग. जम्मू एंड कश्मीर में वहाँ एक जगह है गुरेज, बहुत ठंड है वहाँ पे. मैं अभी बता रहा था, मुसरत मेरा बैचमेट भी है, कि मज़ा लेना है तो चलो मेरे साथ लद्दाख, -25 पे मेरे बंदे काम कर रहे हैं. वी आर जनरेटिंग पावर एट -25 डिग्रीज. रात में बहुत टफ है, लेकिन हमने वहाँ पर, अब मैं लेता हूँ हेल्थ में, हमने वहाँ पे अपोलो का टेलीमेडिसिन ICU सेटअप करके रखा हुआ है. 1 डॉक्टर 6 पैरामेडिक्स. और फ़ायदा ये हुआ, जैसे वो कहते हैं ना कि बीमारी को पकड़ लो. जो वहाँ के जो DGM थे, ही वॉज नॉट फीलिंग वेल, डिस्कम्फर्ट था, तो उनको लोगों ने सजेस्ट किया कि जस्ट आप चले जाओ टेलीमेडिसिन. अच्छा, दैट इज़ नॉट मेंट फॉर माई एम्प्लॉयज़ ओनली, इट इज़ फॉर एंटायर द गुरेज पॉपुलेशन, बिकॉज वहाँ पे कुछ था ही नहीं. और 4 महीने वो कंप्लीट कट ऑफ है. ओनली द डिस्ट्रिक्ट चॉपर इज देयर. उस बंदे का BP था 170/110 एट अ टेम्परेचर अराउंड 0 डिग्री होगा. तुरंत उनको हम लोगों ने, उस टाइम रोड ब्लॉक नहीं हुआ था, इमीडिएटली हुआ शिफ्टेड टू अपोलो हियर. इसके पहले कि हार्ट अटैक होता, एक उनका 99% का ब्लॉकेज था, स्टेंट लगाया, बच गया.
राइट.
इस तरह से
तो डिफिकल्ट जगहों पर जहाँ पे ज्योग्राफिकल मुश्किलें हैं, वहाँ पर टेक्नोलॉजी एक बड़ा रोल प्ले कर रहा है और आप लोग उसका इस्तेमाल कर रहे हैं. टेलीमेडिसिन जो है वो आप लोगों के लिए एक रियल ताकत साबित हो रहा है. कुछ और मेहमानों से बात करते हैं. भावना, आपसे मैं बात करना चाहूँगी, वाइस प्रेसिडेंट पीपल एट S&P ग्लोबल. वेलकम टू TV9 नेटवर्क्स प्लेटफॉर्म. वर्क प्लेसेस जो हैं अब किस तरह से बदल गए हैं, और मुझे हमेशा लगता है कि एक समय था, मुझे लगता है कोविड जो है ना, वो एक फैक्टर रहा है जो डिसाइड कर रहा है एक दुनिया जो कोविड के पहले थी और एक दुनिया जो कोविड के बाद है. और ये जो कोविड के बाद की दुनिया जो हम लोग सर्वाइव कर चुके हैं और यहाँ पर हैं, मुझे लगता है आप लोगों के लिए ऑर्गेनाइजेशन में चीज़ें बहुत बदल रही हैं. और आप लोग हेल्थ टेक का इस्तेमाल कैसे कर रहे हैं और कितनी मदद मिल रही है?
थैंक यू प्रियंका, प्लेजर टू बी हियर. आई थिंक हम कोविड के बारे में तो काफ़ी बात करते हैं, बट द फैक्ट ऑफ द मैटर इज़ दैट देयर आर मेनी ग्रेट इक्वलाइजर्स, और टेक्नोलॉजी उसमें से एक बड़ा इक्वलाइजर है. आज की तारीख में अगर आप देखें, द एक्सपेक्टेशंस दैट एम्प्लॉयज़ हैव इज़ for the medical infrastructure to be as seamless as using WhatsApp. तो जितनी आसानी से आप WhatsApp को यूज़ करके communicate कर सकें, people want medical support, technology infrastructure to be able to support medical requirements. And I think हमारे लिए we've been using the power of technology in 2-3 ways at S&P. One is health and well-being itself, uski definition काफ़ी broad हो गई है. When we heard Sunil previously and also the previous panel, you would have noticed that there was an emphasis on different dimensions of health and well-being: physical, mental, emotional, spiritual, and financial. Right? So today, as organizations, it's not only important for you to have insurance in place, it is also important for you to think about how are you providing all other kinds of support. What are 2 or 3 things that we are doing? One, we do have a tech-enabled platform where people can go on, they can get access to any doctor, any kind of treatment, any kind of tests that need to be done. तो वो तो access है ही, OPD access, cashless facilities, that's table stakes. In my view, if that is not there, then we need to think about whether we have a foundation of health and well-being in the organization or not. But isse ek step upar, which we are actively involved in, is how are we supporting mental well-being, stress, grief, loss. These are all realities of today, and we're a global organization. हम दुनिया के हर हिस्से में काम करते हैं. We have a partner in the mental well-being space as well, right? So today, for any kind of counseling support that people require for mental wellness, they don't have to go have a conversation with somebody to get an access. We have a partner with whom that support is available 24/7. You can get that counseling support. Third thing, wellness के मायने अलग लोगों के लिए अलग चीज़ें होती हैं. And a big part of that is also downtime. So S&P में हमने, it started during COVID. A lot of organizations had well-being holidays Well, it's been a few years since COVID. हमारे यहाँ पे आज तक 5 well-being holidays हर साल होती हैं. The entire company shuts down. It's either a Friday or a Monday, so that gives everybody the benefit of a long weekend. And people can de-stress. Stay with me for a minute. The other thing that we have done is we have instituted a well-being allowance for every single employee across the world. And that well-being can again be anything that you want it to mean. The last example that I want to leave with you is, how do we create an environment where there is psychological safety? We are all, well, most organizations pride themselves on being high-performance organizations, but high performance happens when you have happy people, when you have people who enjoy what they do, who are important to connect their, who are able to connect their purpose with the organization's purpose, and creating that space through people resource groups, communities, where people can give back, volunteer, they can support the larger ecosystem. That's the other part of wellness, which we sometimes don't talk about, but which is important for us.
I was not at all interrupting you. In fact, I was asking you, should I apply at your company, you know? And I think many of us would want to, with that well-being allowance, something which has really, you know, stolen the cake here. Wow, Bhavna, great job, I think. Sipika, now moving on to you. आप इतने सारे organizations में काम कर चुकी हैं, अभी आप EXL में हैं. Organizations कर रही हैं बहुत कुछ, लेकिन कहाँ लैक कर रही हैं आपको लगता है? मैं ये आपसे पूछना चाहूँगी, क्या हेल्थ टेक का इस्तेमाल जिस तरह से होना चाहिए हो रहा है? क्या मेंटल वेलबींग पर भावना जिस कंपनी को बिलोंग करती हैं जितना फोकस कर रही हैं, क्या सारी कंपनियां कर रही हैं? क्या किए जाने की ज़रूरत है?
Thank you. Thanks for that question, and I'm glad to be here. Before I come to your question, I would like to first of all, set the context and why healthcare, why we are talking about so much about wellness, healthcare tech, why in the last few years it has become very prominent. And the answer to that lies in the definition of workplace itself. Now the boundaries of workplace and has been so blurred that your personal space and workplace is one or the same thing. You're traveling, you are on a vacation with the family, you're carrying your laptop. You're always checking your Outlook for your mails, for your messages, despite putting out of office. Because the way workplace has shifted, right? The boundaries have blurred, and the way the design has happened. There are timelines which are impractical at times. There is always a desire to do better. If I contrast and compare it to the work that used to be there in previous years, it was very well defined, well structured. And in 80s, I'm a kid of 80s, and just a show of hand, how many of you are 80s born? Okay. From the audience, please raise it up so that everyone can see it. So we all 80 kids have one thing in common. We have seen, since we are in a TV network, I'll take the example of TV. We used to have one TV in the house, that too in a big household. There are multiple family members are there, but there used to be either one remote or you have to go to the TV and push the button. And in that environment, only one channel used to play for all the family members. You were very comfortably used to enjoy everything. That was the healthcare of previous years. One size fits all. But our today employee, the employee of 2025, is not living in that generation. He's exposed to Netflix, OTT, anything of their choice. And that too in one household, you will notice that every room will have TV.
We are spoiled for choices.
Right? So many choices. And in one family, if you have two kids, both the choices of each of the child will be different. And they are having the exposure to implement those choices, and these are the future employees and present employees as well. What is happening now is in healthcare also, this shift is required. From one size fits all to a hyper-personalized kind of healthcare, wherein we create, as employers, we need to create choices for our employees. We cannot decide for every generation or every employee because each one is unique. And an employee is a person first, then a resource. And for that person, personalization is important because care, whenever it is personalized, then trust is created. हमने कभी नहीं सुना होगा कि कहीं एक generic prescription लेकर के अच्छा pollution बहुत हो रहा है दिल्ली NCR में एक ही prescription public forum पे आ गया and सबने वो use कर लिया. That has never happened, right? Healthcare tech has to be personalized, customized for each individual, and that's where technology plays a key role. when we create an app or when we create a benefit, the utilization becomes a challenge. So anything in wellness is something which has to be in the fingertip of employees. They should know how to navigate the complex HRMS or HR tools which are available in the organization. It should be whenever they need it. They should have free access to the healthcare and support. And sometimes, in the fast response to employees and in the wake of creating so many things for employees, we left with a very important aspect, which is communication and ease of use. So these two things are very, very important to my mind. And secondly, the leadership support and endorsement. The leadership support helps in creating a culture where psychological safety, which Bhavna has pointed out, is very, very important to create as a culture, because unless that is the grassroots. Why we are seeing so many topics about mental well-being, stress, workplace health and safety issues, right? Because there is a lot of stress in the system, entire system. You have to reach timely, but traffic is unpredictable. You have to submit something in deadline. You are not given clear directions. So many ambiguity is there in the environment, which we all are dealing with. And that's where leaders have to be person first. They have to create an environment of psychological safety, define outcome-based work, define the boundaries between personal and professional, and be respectful to their employees, create that culture.
स्ट्रेस लेवल बढ़ गया है, इससे मुझे नहीं लगता है कोई डिसएग्री करेगा, लेकिन आपने एक बात कही, हाइपर पर्सनलाइज बनाना होगा सिस्टम को, which is true, which is correct. But अनिल, हाइपर पर्सनलाइजेशन करना है, आपको एक ऑर्गेनाइजेशन भी चलाना है, लोगों के आउटपुट का भी ख्याल रखना है, इन सब को बैलेंस करना आसान नहीं है.
True.
It's on.
Okay. Is this on now? Can you hear me? Thank you. So, I'm going to answer your question. I'm sorry, I'm going to speak to in English, and I'll jump in Hindi as well wherever I can. But listen, your question, I think, is really talking about how do you manage these perspectives. But I'd like to zoom out a little bit, if that's okay. Look, we are a country with 1.46 billion. We have a supply side and a demand side of healthcare. And all of this, somewhere lies insurance, medical insurance, wellness, and well-being, and employers and consumers. So let's first understand that. Now, in a country where you have a supply and demand size of this size, the medical care business is about 648 million, or possibly going to double. So it's going to cross some 1.2 billion in the next 3 to 4 years. And then you have this huge demand coming in from people, be it as employees, be it as consumers, post-COVID. In fact, your earlier question, pre and post, huge shifts have happened here, right? IPD only became IPD plus OPD. The average medical covers, which were 3 to 5 lakhs, have moved from 5 to 7.5 to 8. The penetration level, which is just about 20%, is now, which basically meant 70% were underinsured or did not know anything about insurance. Today, that number has gone down to about 58, 60%. You still have 40% which is using insurance, but that's a large number, it's a huge gap. And somewhere in between lies the middle, which is the underinsured, which is about 400 million on an employee, on the country base of 1.46 billion. Look, these are larger things we need to address about. And then there are 3 key policy shifts that have happened. First, the maternity bill itself, 2017, that made a lot of things change for women. 2, the landmark labor code bill that's happened in November recently, which brings in gig workers, contract employees, and so on and so forth. And the third one, which something she was talking about, which is the right to disconnect, right? And if all of these things, if you just look at the whole thing on a larger perspective, you are really talking about how do you make consumption of wellness and healthcare happen. That's actually a long-winded answer to your question. Okay? And somewhere in all of this, which is core of it, are two spectrums, starting with design, intent, leading to execution, leading to experience, and a loop that comes back to design. Okay, I think we all need to understand that as either HR professionals or business leaders, on all of that, the ecosystem, a platform that manages a huge database through AI, health tech, and so on. I think we all need to understand the variables and the equations, and in a way, I think put on a lens for the future as well, because the products are going to change. And to her point, they are going to get more and more individual. The consumer consumption is going to change, the business models are going to change, the wallet sizes are going to change, right? And the way the experience one wants to choose is also going to evolve, right? And lastly, I just want to leave you with this. This 1.46 billion is going to become 1.7 billion by 2040, right? And then from there on, you're going to have a older set of Indian demographic shift. Now, right now, we have a situation where if you're above 45, and if you are 65, the cost of insurance is very high. The cost of medical expense has almost doubled. The insurance expense or premiums have doubled. So you are dealing with a lot of things here. And I think in all of this, use of technology, AI, hypertech, and evolving business models, deploying AI, is really look at a larger question on how do you relook at underwriting some of these risks and make it wallet suitable as you put on a lens, rather than we're trying to figure out which organization has done wellness, which organization hasn't. I think we have larger picture. And then really boiling down to organizations, because there'll always be progressive organizations who will do better. कोई ना कोई organization आपको मिलेगा जो बड़ा काम कर रहा है.
But there's no running away from technology. You have to use it.
Absolutely.
Because, and as you said, you have to zoom out and you have to look at the bigger picture. And there are a lot of variables here.
Can I just give you thank you. Can I just give you one more example? I think the cost of providing healthcare solutions and options to colleagues in organizations has gone up exponentially, right? Just look at the kind of, and we have many professionals over here, think about the kind of investment that your organizations need to make per capita in medical insurance policies, in offering various solutions, etc., that are there. The big question is, how many of these are valuable and how many of these are not? So today, one of the moves that is happening in healthcare, and it's a slower moving move as compared to a lot of other types of analytics, is to say, and through our partners, we're working on this journey, we're not quite there, is to say that of all of the healthcare related benefits or the well-being related benefits, where do you have the maximum traction? Where do you have the maximum utilization? What is the trending data telling you? Therefore, where should you double down investment and where can you afford to maybe be a little conservative and wean off investment so that it is meaningful? And you have to do this for large group trends without getting into the privacy of individuals, right? So using the power of data, analytics, and technology to do that, that is the next evolution in this frontier that we are heading towards.
So, उत्तम जी, मैं आपसे पूछना चाहूँगी कि हम यहाँ पर हमारे जो तीनों ही पैनलिस्ट हैं, वो बड़े शहरों में बड़े ऑफिसेस चला रहे हैं, बड़े फर्म्स चला रहे हैं, MNCs हैं, में काम कर रहे हैं, लेकिन आपके साथ चुनौती है ज्योग्राफिकल कंडीशन की भी. आप बहुत ही टफ टेरेन में आपके एम्प्लॉयज हैं. उनको जोड़ने के लिए टेक्नोलॉजी एक बहुत महत्वपूर्ण भूमिका निभा रही है और आप लोग इसका इस्तेमाल कर रहे हैं.
मैं बताता हूँ आपको. चलिए अब हेल्थ पे आ जाते हैं. हमारा जो एंटायर एम्प्लॉय डाटाबेस है, एज फार एज मेडिकल डाटाबेस, दैट इज ऑन SAP. और हम उसको कैसे टेक केयर कर रहे हैं. वी इंस्टेड ऑफ गोइंग फॉर अ क्योर, हम प्रिवेंशन में ज़्यादा बिलीव करते हैं. वी हैव अ कंपल्सरी मेडिकल चेकअप फ्रॉम द एज ऑफ 25.
That's great. That's really
हाँ,
great.
हर 25 साल पे, 25 साल जैसे ही कोई एम्प्लॉय जनरली जो इंजीनियर्स हैं, कोई 22-23 साल पे भी आ जाता है यंग बच्चा. 25 जैसे ही हुआ, ही हैज़ टू गो. अगर वो नहीं जाएगा, मैं उसका KPA का मार्क्स काट दूंगा, PMS ही विल नॉट बी एबल टू सबमिट. और होता क्या है कि एट द इनिशियल स्टेज कभी कभी बड़ी ड्रीडेड लाइक द इनिशिएशन ऑफ ब्लड कैंसर पकड़ा गया, एंड नाउ द बॉय इज हेल एंड हार्टी. अगर हम और फॉर 40 एंड अबव, इवन दैट अप्लाइज टू मी ऑल्सो. एवरी ईयर, एंड नॉट मी एंड माई वाइफ, जब तक मेरी वाइफ का नहीं होगा, पहले एक टेंडेंसी था कि स्पाउस का लोग नहीं कराते थे. अब कर दिया कि स्पाउस का नहीं कराएंगे, तब तक आपका जो PMS है वो रुका ही रहेगा एंड नंबर कटेंगे आपके. सो थोड़ा सा कंपलसरी कर देता है. एज फार एज द मेडिकल इज कंसर्न्ड, हमारा तो जो CPSCs में देयर इज नो लिमिट. OPD, IPD नो लिमिट, एंड इट्स इक्वल फॉर ऑल, एंड इवन आफ्टर सुपरएनुएशन. तो हम उसको कहते हैं कि नौकरी के साथ भी, नौकरी के बाद भी. हमने उसमें एक और अच्छा 2 चीज़ किया, मैं जस्ट बता देता हूँ. फॉर विमेन एम्प्लॉयज़ एक हमने पिंक लीव भी रखा है, एवरी मंथ 1 डे.
So we come back to that, जो सुनील जी थोड़ी देर पहले कह रहे थे, प्रिवेंशन जो है वो बहुत ज़रूरी हो जाता है. और इसी के साथ बहुत धन्यवाद मैं आप लोगों का करना चाहूँगी, लेकिन साथ ही में मैं स्वागत करना चाहूँगी हमारे चीफ गेस्ट यहाँ आ चुके हैं, श्री प्रताप राव जाधव जी, मिनिस्टर ऑफ स्टेट फॉर आयुष, इंडिपेंडेंट चार्ज, हेल्थ एंड फैमिली वेलफेयर. जोरदार तालियां सर के लिए. बहुत स्वागत है सर TV9 के इस प्लेटफॉर्म में. आज आपने हमारे लिए वक्त निकाला, और मैं अपने साथी पैनलिस्ट का यही यहाँ पर ओके माफ कीजिएगा, मिनिस्टर सर का इंतजार जारी है, अभी मिनिस्टर सर आए नहीं है. So, थोड़ा सा यहाँ सुनने में गलती हो गई, क्योंकि आप लोग इतनी इंगेजिंग बातें कर रहे थे. और हमारे बीच में सुनील बनवाल सर आ चुके हैं. सर नमस्ते, बहुत स्वागत है. माफ़ी चाहूँगी, हमने आपको मैंने आपको बोल दिया. थोड़ी देर में मेरी और आपकी बातचीत होगी, मैं फिर से माफ़ी मांग लूँगी, लेकिन साथ ही में मिनिस्टर सर का भी इंतज़ार कर रहे हैं. इस बातचीत में एक अब लास्ट राउंड ऑफ क्वेश्चन, आप लोगों से एक आइडिया मैं लेना चाहूँगी. अनिल, आपसे शुरुआत करते हैं कि आपको क्या लगता है वर्कफोर्स 2.0 कैसा होगा, क्या होना चाहिए उसमें?
सबसे बड़ी चीज that's going to happen is 2.0 वर्कफोर्स में प्रिवेंटिव हेल्थ केयर सेंटर में रहेगा,
जो अभी उत्तम जी भी मेंशन कर रहे थे, और
उनके-
थोड़ी देर पहले
उनसे-
सुनील जी भी बोल रहे थे विजिट हेल्थ से.
सबसे हम सहमत हैं. Anybody who understands this business will tell you this. Let me put it this way. Look, you will need to invest in preventive care. Somebody was talking about ROI earlier. I think this is the basic common sense, right? If you are putting in investments into preventive care, you will not end up at an IPD. Look, the largest push in terms of any consumption of an insurance product is actually 20% of your consumers or in an employee base. That's driving 80% of your cost, right? So how do you therefore manage a claim ratio, which happens to be your biggest enemy sitting on your P&L? Because that's going to raise your insurance premiums. And by the way, insurance premiums have doubled. It's operating at a CAGR of 28%. In my earlier numbers, when I said here is what the healthcare number is, that was 648 billion, not 648 million, I stand corrected. So just to give you a sense, it's 2.5% of our GDP, and it's going to become 5% of our GDP. So preventive healthcare जो है, वो हर चीज में हमें ध्यान रखना पड़ेगा. जो भी एक प्रोग्रेसिव एम्प्लॉयर है, और सबसे बड़ी चीज जो गवर्नमेंट ने की है, लेबर कोड में जो एनुअल हेल्थ चेक, आज तक कभी नहीं था. आपको कभी सुना था आपने एनुअल हेल्थ चेक गिग वर्कर्स के लिए, वर्कर्स, माइन वर्कर्स के लिए? Have you ever heard? Now, annual health check going down to that level and making it mandatory, bringing in elements where maternity benefits are at par, childcare benefits are at par. Have you heard that before? Equity in pay for men and women. Have you heard that before? So these are the kind of things, that's going to make a difference. Preventive health care will be the driver, will be the change agent in the companies.
Sipika, I would want your view on this. Preventive health care हमारे तीनों ही पैनलिस्ट कह रहे हैं बहुत ज़रूरी हो जाता है और इसमें टेक्नोलॉजी का रोल क्योंकि अब हम प्रिडिक्टिव एनालिटिक्स यूज़ कर सकते हैं. क्या आपकी जैसी कंपनियां या और कंपनियों को इसका इस्तेमाल करना चाहिए? आपकी कंपनी करेगी, कर रही है?
I have been instrumental in designing preventive healthcare programs for my organizations और उसमें हमने limit कुछ नहीं रखा था. Age was no bar at all. What we did is gender specific and age bracket specific test हमने डॉक्टर्स से डिज़ाइन कराया that what is required for this age group and वो सारे टेस्ट customized test which is for employees of a specific gender. The tests that are required for a 40 plus female is not similar to the test which is required for a 25-year-old female. Similarly goes for a male, right? So वो customized test हमने portal पे because technology plays a huge role portal पे था सबके लिए and in that case employees everybody is eligible for one healthcare checkup annually and उसके बाद consultation as well because खाली एक preventive checkup करा लिया and there is a apprehension also employees के दिमाग में कि अगर मेरा health care check या preventive check organization sponsored हो रहा है तो एक बहुत बड़ी एक दिक्कत उसमें challenge आता है कि my employer will be taking decisions based on my health. So उसको दूर करना बहुत ज़रूरी है. It is very important to communicate to employee कि आपका health का जो report है that is directly produced to you. Nobody else in the organization except the employee himself is will be directed that report to or the vendor partners that we have. Sorry for my bad throat. So we ensure that we do not, as HR, we do not link any performance matrix or any biasness towards the employee. In the same side, to continue that, what is important is care management and specific care management. अगर वो सारे options employee ने preventive health checkup किया है, तो उसके बाद what next? उसके बाद organization क्या support कर सकती है? Can we create diabetics management program, hypersensitivity management program, sleep deprivation management program? So वो सारी choices हमने create किया था.
मेरे मन में एक सवाल ये आ रहा है, ये सारे programs अगर हम बात कर रहे हैं, तो इसमें एक बहुत बड़ा factor cost का भी रहेगा भावना. राइट तो क्या कंपनियां इस तरह के कॉस्ट को अपफ्रंट लेना चाहती हैं वो इस कॉस्ट को कैसे देखती हैं आप लोगों के भी व्यूज लूंगी लेकिन कॉस्ट एक बहुत बड़ा फैक्टर है सिपिका एक बार भावना का व्यू सुन लेते हैं फिर आपके पास आती हूँ
I think cost एक फैक्टर है but at the end of the day I think दो shifts आपको दिखेंगे one थोड़ा uncomfortable होगा but we're going to have to realize that senior people don't have all the answers. And healthcare options have to be democratized. You have to leave the choice of what healthcare option I want to exercise as an employee versus you want to exercise as an employee versus you want to exercise as an employee to the employee. Because by the way, it's a myth that people who are 25 are not having heart attacks. And it's a myth that mental health issues are not gripping people who are in their teens. So healthcare is very personal. And one of the big shifts in organizations is we have to create that room that hum alag options available kare, but give that choice of what we want to bring in to employees. That's shift number one. I think shift number two, and I agree with you, I think preventive healthcare is absolutely crucial. The focus on mental well-being. That has to go up. It's
but
not
you're
just
not giving me an answer.
mental.
Our company is willing to spend. Cost
Of
is a
course.
big factor.
The second you bring in analytics into what makes sense and what doesn't make sense, you are enabling yourself to make sensible investments. That's one. The second is already in India, it's definitely a reality across the world also, but in India, there are organizations who are being real and who are going into copay as an option. Right? You want to create some percentage of cost is being borne by people who want to take the benefit of the kind of volumes that organizations can bring in terms of options, but they want to have that additional delta of support available for their particular context. Copay is a really good option and it's worth exploring. It may not be for everything, but for certain more premium options that you want to have available, there's absolutely no harm in exploring copay. The last piece that I do want to leave with you as a thought, Priyanka, and with everybody over here is health and well-being is non-negotiable. I think somebody on the previous panel had spoken about it not as a cost, but as an investment. And the more we see it as an investment, it's okay to give less equity. It's okay to give 1% less bonus, but it is not okay to compromise on healthcare options for your people, because that's really the differentiator.
And how's the employee outlook changed, Anil? I mean, what do you see? I want to just change side and take a back seat, and I want to ask you, are employees going and asking their companies what health benefits are you giving? Because, you know, the new generation who's joining, they want more flexible hours than the health benefits.
Yeah, absolutely. They're getting, you know, there is a lot more awareness on well-being and insurance cover. And in fact, you'll have people, you know, someone who's been in the BFSI industry, I can tell you this, they ask you, fine, comp is one thing. What about my benefits? What about my well-being? How do you stand out as an employer? Right? So, bilkul पूछते हैं. And they in fact ask and make choices. Your extended family, I mean, where are parents in all this? Right? You have your elderly, you have your immediate dependents, you're at different segments. They're all the needs. So each one of them do ask. And you have to create products to be able to take care of it, that you know, to answer your question directly. तो बिल्कुल पूछते हैं और उनको उनके डिमांड के हिसाब से आपको प्रोडक्ट्स भी डिजाइन करने पड़ते हैं.
राइट. सो चलिए, ये अच्छी बात है कि इन्फॉर्म डिसीजन ले रहे हैं लोग और वेलबींग को अब अपने चॉइसेस में बहुत इम्पोर्टेंस दे रहे हैं. थैंक यू सो मच माय पैनलिस्ट फॉर दिस कॉन्वर्सेशन. और एक फोटो हम लोग लेते हैं आज की शाम को और यादगार बनाने के लिए. बहुत शुक्रिया आप लोगों का. प्लीज कम. Thank you.
All right, so that was another fascinating session, wasn't it? And you were literally asking for jobs after that. To be honest, you know, we are here holding this summit, but fact of the matter is that we have our very special guest of honor for the evening who is just arriving as we speak. Ladies and gentlemen, our special guest for the evening has indeed arrived, and he will be delivering the keynote address for tonight. Isn't it, Priyanka ji?
Yes, a big hand for our chief guest, Shri Pratap Rao Jadhav ji, Minister of State for Ayush, Independent Charge, Health and Family Welfare. बहुत स्वागत है सर आपका TV9 नेटवर्क के इस खास आयोजन में. आपने वक्त निकाला अपने व्यस्त शेड्यूल से. जोरदार तालियां मिनिस्टर साहब के लिए.
All right, and to honor and felicitate the Honorable Minister, I'm going to invite on stage a couple of very special gentlemen to first to do the felicitation.
Okay, आप सभी से रिक्वेस्ट करेंगे कि प्लीज बैठ जाइए, अपना स्थान ले लीजिए.
Before we go any further.
Yes. हमारे बीच हमारे चीफ गेस्ट श्री प्रताप राव जाधव जी, मिनिस्टर ऑफ स्टेट फॉर आयुष, इंडिपेंडेंट चार्ज, हेल्थ एंड फैमिली वेलफेयर आ चुके हैं. बहुत धन्यवाद सर, आपने व्यस्त शेड्यूल से हमारे लिए वक्त निकाला. एक बार जोरदार तालियों से स्वागत कीजिए ऑनरेबल मिनिस्टर साहब का.
He will be delivering a keynote address. He's the man shaping health and wellness in the country, and it's so we are profoundly honored by your presence here, sir. आज आपने decide किया कि ये शाम हमारे साथ बिताएंगे. इसके लिए we are very, very happy. Thank you so much. And before we get you on stage, let me get on stage the gentleman who will be felicitating our guest for the evening. Let me please invite on stage Mr. Kartikeya Sharma, Managing Editor of News9. Huge round of applause to Mr. Kartikeya Sharma. And we also invite Mr. Anurag Prasad, CEO and co-founder, Visit Health, to please take the stage. Thank you.
A big round of applause. और अब मैं आमंत्रित करना चाहूंगी हमारे चीफ गेस्ट आज शाम के श्री प्रताप राव जाधव जी को, मिनिस्टर ऑफ स्टेट फॉर आयुष, इंडिपेंडेंट चार्ज हेल्थ एंड फैमिली वेलफेयर। मिनिस्टर सर, आग्रह करूंगी कि आप प्लीज स्टेज पर आए।
Requesting the presentation of the shawl and the bouquet to our chief guest for the evening. Kartikeya ji, please, with the shawl. And requesting all of you to stand for the photo op as well. Thank you, Kartikeya ji. Thank you for felicitating our guests, for requesting the minister to please stay on stage, sir.
Minister sir.
Sir, Shri Jadhav ji, please, requesting you to please come on stage. Come to the podium over here. Requesting you to deliver the keynote address focusing on India's evolving wellness vision and the preventive health roadmap really, and the integration of traditional systems like Ayush with state-of-the-art modern healthcare. Requesting the minister to please say a few words.
आज यहाँ पर उपस्थित पारंपरिक और आधुनिक स्वास्थ्य तकनीक और कार्यबल विकास का संगम में उपस्थित माननीय अतिथियों, मीडिया जगत के मित्रों, देवियों और सज्जनों, इस टेक समिट में उपस्थित श्री कार्तिकेय शर्मा, मैनेजिंग एडिटर, और सभी उपस्थित देवियों और सज्जनों, आप सभी को मेरा नमस्कार। आज हम एक ऐसे महत्वपूर्ण अवसर पर इकट्ठे हुए हैं जहां पारंपरिक स्वास्थ्य और आधुनिक चिकित्सा का संगम हो रहा है। यह संगम न केवल हमारे देश के स्वास्थ्य क्षेत्र में एक नए युग की शुरुआत है, बल्कि यह विकसित भारत के निर्माण में भी एक महत्वपूर्ण भूमिका निभाता है। हमारे आदरणीय प्रधानमंत्री श्री नरेंद्र मोदी जी का सपना आज़ादी के शताब्दी वर्ष तक भारत को विकसित राष्ट्र बनाने का है। यह सपना तब तक पूरा नहीं हो सकता जब तक भारत स्वस्थ और सबल न हो। हमारे देश की 65% आबादी युवाओं की है, लेकिन उनका स्वस्थ होना भी बहुत जरूरी है। आज कुपोषण, विटामिन डी की कमी, लाइफस्टाइल से जुड़े मधुमेह, हृदय रोग, किडनी रोग, मनोरोग, तनाव जैसे गैर संचारी रोग हमारी आबादी में तेजी से बढ़ रहे हैं, जिससे हमारी उत्पादकता घटने की चुनौती भी सामने आ रही है। इलाज का भारी भरभक्कम खर्च हमारी खुद की और देश की तरक्की में बाधक बन सकता है। इसलिए हमें अपनी सेहत पर खास ध्यान देने की ज़रूरत है और इसके लिए अपनी दिनचर्या, ऋतुचर्या और आहार विहार को ठीक करना होगा। जंक फूड से दूरी बनाकर हेल्दी खान पान, योग, ध्यान और नियमित शारीरिक व्यायाम की ओर भी ध्यान देने की ज़रूरत है। प्रकृति के साथ जुड़कर ही हम स्वस्थ रह सकते हैं। पारंपरिक चिकित्सा को आधुनिक चिकित्सा के साथ मिलकर काम करेंगे तो हम बेहतर परिणाम हासिल कर सकते हैं। पारंपरिक स्वास्थ्य और आधुनिक चिकित्सा का संगम हमारे देश की प्राचीन ज्ञान परंपरा और आधुनिक तकनीक के बीच एक सेतु का निर्माण करता है। आयुष मंत्रालय द्वारा संचालित विभिन्न कार्यक्रम और योजनाएं इस दिशा में महत्वपूर्ण कदम बन रहे हैं। हमारे आदरणीय प्रधानमंत्री जी ने आयुष्मान भारत योजना के तहत स्वास्थ्य सेवाओं को मजबूत करने और पारंपरिक स्वास्थ्य को बढ़ावा देने के लिए कई महत्वपूर्ण पहल की है जिसमें आयुष को भी शामिल करना है। तकनीक का उपयोग हमारे स्वास्थ्य क्षेत्र में एक क्रांतिकारी बदलाव ला रहा है। डिजिटल स्वास्थ्य रिकॉर्ड, टेलीमेडिसिन और एआई आधारित स्वास्थ्य सेवाएं हमारे देश के स्वास्थ्य क्षेत्र को और भी मजबूत बना रही है। तकनीक का उपयोग करके हम ऐप्स की मदद से स्वास्थ्य सेवाओं को और भी सुलभ और प्रभावी बना सकते हैं। परंपरागत चिकित्सा पद्धतियों में लोकप्रिय आयुर्वेद, योग, ध्यान, पंचकर्म, मसाज, कृत्रिम चिकित्सा और प्राकृतिक आहार के लिए प्रशिक्षण देकर हमारे युवाओं को रोजगार के अपार अवसर मिल सकते हैं। किसानों को औषधीय पौधे की खेती करने का प्रशिक्षण और प्रोत्साहन देकर भी रोजगार और समृद्धि दोनों के द्वार खोले जाने की जरूरत है। इससे हमारी दवाओं की क्वालिटी भी बढ़ेगी और इलाज भी कारगर होंगे। प्रशिक्षित कार्यबल विकास भी हमारे देश में स्वास्थ्य क्षेत्र में एक महत्वपूर्ण पहलू है। हमें अपने स्वास्थ्य कर्मियों को आधुनिक तकनीक और पारंपरिक स्वास्थ्य के बारे में प्रशिक्षित करने की भी आवश्यकता है। आंतरिक रूप से हमें अपने स्वास्थ्य क्षेत्र में सुधार के लिए कई कदम उठाने होंगे। हमें पारंपरिक स्वास्थ्य और आधुनिक चिकित्सा के बीच समन्वय स्थापित करना होगा। तकनीक का उपयोग बढ़ाना होगा और कार्यबल के विकास पर ध्यान देना होगा। यही स्वस्थ भारत का मूल मंत्र है। आधुनिक भारत के निर्माण में स्वास्थ्य क्षेत्र की महत्वपूर्ण भूमिका है। हमें इस दिशा में और भी प्रयास करने होंगे ताकि हम अपने देश को एक स्वस्थ और समृद्ध राष्ट्र बना सके। आपने मुझे यहाँ आमंत्रित किया, इसके लिए मैं आप सभी को हार्दिक धन्यवाद देता हूँ। जय हिंद, वंदे मातरम।
Thank you so much, sir. Requesting to please stay on stage, sir. Jadhav ji, please stage पे आ जाइए।
मिनिस्टर सर, आपसे अनुरोध है कि आप हमारे साथ मंच पर बने रहे, क्योंकि अब वो वक्त है जब हम एचआर विजनरीज को उनके बढ़िया काम के लिए फेलिसिटेट करने वाले हैं और आपकी मौजूदगी इसमें और मायने जोड़ती है सर। थैंक यू सो मच।
Huge round of applause for our chief guest who's taken time out not just to speak to us but also to give away the first set of HR Visionaries Awards. We now honor the first set of HR leaders who continue to build cultures rooted in empathy, wellness, and more importantly, people first practices.
Yes, absolutely, Krishna. और मंत्री सर के साथ मैं आमंत्रित करना चाहूंगी कार्तिकेय शर्मा, मैनेजिंग एडिटर न्यूज़ 9, वैभव सिंह, को-फाउंडर एंड एमडी विजिट हेल्थ। आप दोनों को भी कि मंच पर आए और अब हम आगे बढ़ रहे हैं।
Okay, so let's begin with the first HR visionary. We begin with a pioneering leader in India's healthcare ecosystem, a doctor who has played a transformative role in shaping quality accreditation and policy frameworks across hospitals in the country. And we're talking about Dr. Giridhar Gyani, Director General of AHPI. And to accept the award, let me please invite on stage Dr. Sunil Ketrapal.
Okay, let's move on to the next set of award. हम माफी चाहेंगे, वो आज हमारे साथ नहीं आ पाए, उन्होंने कंफर्म किया था, ट्रैफिक में फंसे हुए हैं। हम अगले अपने शख्सियत की तरफ बढ़ते हैं और डॉक्टर विनय कुमार जी हमारे बीच में होंगे। डॉक्टर विनय कुमार, आपसे अनुरोध करूंगी कि प्लीज स्टेज पर आए। आपने जो बढ़िया काम किया है इसके लिए हम चाहते हैं कि आप हमारे स्टेज पर आकर के ये अवार्ड लें। डॉक्टर विनय कुमार is recognized for his impactful leadership and contribution to advancing healthcare system, innovation and people-centric excellence. A big round of applause for Dr. Vinay Kumar. Vinay Kumar जी, बहुत बहुत बधाई आपको, इस बढ़िया काम को आगे बढ़ाते रहिए। जोरदार तालियां डॉक्टर विनय कुमार के लिए.
Moving on. Next, we have somebody who's a seasoned HR leader. He's been driving people strategy and organizational excellence at Kotak Mahindra Bank with a strong focus on performance, culture, and leadership. Ladies and gentlemen, please put your hands together for Pramit Sen, Executive Vice President, Human Resources, Kotak Mahindra Bank. Huge round of applause for Pramit Sen.
प्रमित सेन जी को बहुत बहुत मुबारकबाद और बढ़ते हैं हमारे अगले ऑनर्स की तरफ और मैं आमंत्रित करना चाहूंगी जया रामचंदानी जी को सीनियर डायरेक्टर कॉम्पनसेशन एंड बेनिफिट्स Gartner. A big round of applause for Jaya Ramchandani. Jaya Ramchandani leads compensation and benefits strategy at Gartner, bringing deep expertise in global rewards, governance and pay equity. Zordar taliyan.
Up next, we have somebody, again, we said seasoned, now you're talking about a veteran HR leader. His leadership continues to shape workforce excellence at India's largest automobile manufacturer. Ladies and gentlemen, please put your hands together for Mr. Salil Lal, Chief Human Resource Officer at Maruti Suzuki India Limited. He's right at the back of the room. Huge round of, please keep the applause going for Mr. Salil Lal. Maruti Suzuki, I don't know anybody here who has never owned a Maruti.
वर्क प्लेसेस के एचआर को ये वो चेहरे हैं, ये वो लोग हैं जो तेजी से बदल रहे हैं, टेक्नोलॉजी को अपना रहे हैं और उन्हें हम कर रहे हैं सलाम। और इस कड़ी में अगला नाम मैं लेकर आ रही हूँ आदित्य बिरला कैपिटल के एग्जीक्यूटिव वाइस प्रेसिडेंट एंड हेड कॉम्पनसेशन एंड बेनिफिट संजय सिंह जी को मैं आमंत्रित करना चाहूंगी स्टेज पर। संजय सिंह जी के लिए जोरदार तालियां। संजय सिंह जी 22 साल से भारत और अंतर्राष्ट्रीय संस्थानों में कॉम्पनसेशन, एम्प्लॉय बेनिफिट्स, एचआर पॉलिसीज पर काम करते आए हैं, हमारे बीच हैं आज। और जोरदार तालियां संजय सिंह जी के लिए।
That's right. Sanjay Singh ji has been part of the fascinating panel discussion for tonight as well. Thank you for being a part of that as well. And now we have another person who was already part of the panel discussion for the evening, who's winning the HR Visionaries Award, and that is somebody who leads the India operations for an American multinational company called Chegg. He's been championing people leadership, organizational growth, and employee well-being. We're talking about Mr. Uday S. Karthikeyan, Managing Director, India for Chegg. On behalf of him, I would like to call on stage Mr. Anmol Malhotra to please receive our token of appreciation. Mr. Anmol Malhotra. Huge round of applause for Mr. Uday S. Karthikeyan and Chegg Inc.
और हमारे अगले एचआर विजनरीज हैं सतीश खेंगरे, चीफ ह्यूमन रिसोर्स ऑफिसर, फिजिक्स वाला। तो जोरदार आईपीओ के बाद सतीश खेंगरे जी को अपने अच्छे एचआर के काम के लिए बुला रहे हैं। ऑन बिहाफ ऑफ मिस्टर खेंगरे, आई वुड लाइक टू इनवाइट मिस्टर गणेश यादव टू रिसीव द टोकन ऑफ अप्रिसिएशन. Satish Khengre is driving people and culture strategy at Physics Wala, supporting rapid scale and high growth transformation. A big round of applause for Mr. Satish Khengre and Mr. Ganesh Yadav. जोरदार तालियां हमारे सभी एचआर विजनरीज का। मिनिस्टर सर, आपका भी बहुत बहुत शुक्रिया, आपने वक्त निकाला सर। आप अपना स्थान ग्रहण कर सकते हैं। थैंक यू वैभव, थैंक यू कार्तिकेय जी, थैंक यू सो मच
Jadav ji and Karthikeya ji and the entire presentation party, if I can call it that. Thank you so much. Huge round of applause, and it's been a pleasure having the right minister in the house for the right event and for the right subjects that we're discussing, isn't it? It's
Absolutely.
Health and well-being is the subject, and it needs support not just at the company level, it needs support at the government level, it needs a policy support. You know, the fact that we have a bill which is, asking for a right to disconnect.
Yes.
Also means that it's not just the Indian corporate ecosystem, it is the Indian policy-making ecosystem which has taken cognizance of the importance of health and wellness for, the salaried class, isn't it?
Right to disconnect की तो अब बात हो रही है कृष्णा, लेकिन इससे पहले हमने देखा जो सरकार नए लेबर कोड लेकर आई है, ये एक बहुत बड़े पॉलिसी शिफ्ट की बात कर रहा है। जो वादा किया वो लेकर आ रहे हैं, ऑक्यूपेशनल सेफ्टी से लेकर के एक पॉइंट जो मेरे दिल के करीब है कि महिलाओं और पुरुषों के बीच में जो पे पैरिटी होनी चाहिए, मैटरनिटी लीव को लेकर के जिस तरह की फ्लेक्सिबिलिटी दी जा रही है, मुझे लगता है कि ये जो नया लेबर कोड है,
आज जमाना है पैटर्निटी लीव का।
आप इसके लिए अगले लेबर कोड में ट्राई कर सकते हैं, लेकिन इस बार के लेबर कोड में तो अभी पैटर्निटी लीव मुझे लगता है ऑर्गेनाइज, लेकिन बट यू आर राइट, इट इज समथिंग दैट वी शुड थिंक अबाउट एज वेल। कृष्णा जैसे लोगों के लिए जिनको शायद जरूरत पड़ेगी।
नहीं, अभी तक तो जरूरत नहीं पड़ी, लेकिन I'm just saying for all the men out there, the fathers out there, who again will be found fault with for not spending enough time at home after the birth of a child, for their sake, I'm talking about there's paternity leave that a lot needs to be done. If that is one thing that is very clear in this evening, a lot has happened, and to deal with all that has happened, a lot needs to be done. And we have somebody to talk about it further, a very special guest, our guest of honor for the evening. I'm going to invite the guest of honor for the evening, ladies and gentlemen, with a big round of applause, Dr. Sunil Kumar Barnwal, CEO of the National Health Authority. Mr. Barnwal, please requesting you to come on stage. And to felicitate Mr. Barnwal, and to felicitate Mr. Barnwal, before he gets into a conversation with Priyanka, please invite on stage Mr. Prasanna Raghav, Senior Vice President and Head Branded Content of TV9 Network, and also Mr. Sunil Shrivastava, Chief Business Officer of Visit Health. Please come on stage. We can do the photo opportunity first, even as we wait for the bouquet and the shawl to arrive. That's right, we have it now. Fantastic. Requesting Prasanna ji to please present the shawl. Okay, the bouquet. Okay, and with that, it's time for a very intimate conversation with our guest of honor for the evening. And for that conversation, I'm going to leave it all up to Priyanka. Priyanka ji, the floor is all yours.
थैंक यू सो मच कृष्णा। और अब वक्त है हमारे गेस्ट ऑफ ऑनर के साथ एक खास बातचीत का, जिसकी थीम है स्ट्रेंथनिंग इंडियाज नेशनल हेल्थ मिशन थ्रू हेल्थ टेक। इसमें हम बात करेंगे हेल्थ सेक्टर में बढ़ते डिजिटल ट्रांसफॉर्मेशन की, कैसे पीएम जय से लेकर के आयुष्मान भारत डिजिटल मिशन, डिजिटल हेल्थ आईडीज, इंटरऑपरेबिलिटी, ये हमारे लिए हेल्थ केयर को एक्सेसिबल बना रहा है, अफोर्डेबल बना रहा है। और ऐसे देश में जहां डाइवर्सिटी इतनी है तो इनके कंधों पर भार भी बहुत ज़्यादा है। श्री सुनील कुमार बर्नवाल जी, बहुत स्वागत है आपका। आप चीफ एग्जीक्यूटिव ऑफिसर हैं नेशनल हेल्थ अथॉरिटी के। शुरुआत में मैं माफ़ी मांग लूँ, थोड़ा सा मिस्टेकन आइडेंटिटी के लिए मैं आपसे माफ़ी मांगना चाहूँगी। सर, आपके पास माइक है सर? जी, प्लीज़ यूज़ दैट माइक। वंस अगेन सर, वेलकम टू आवर प्लेटफॉर्म। और सबसे पहले आयुष्मान भारत डिजिटल मिशन एक मिशन ही है ये, और अभी आप इसे कहाँ देख रहे हैं? आप लोग जो चाहते हैं कितना अचीव कर पाए हैं? चैलेंजेस, काफ़ी चैलेंजेस ओवरकम किए हैं, लेकिन अभी कोई चैलेंज जो आप देख रहे हैं इसके इम्प्लीमेंटेशन में, और कितना अचीव किया है अभी तक, कितना पाया है अभी तक आप लोगों ने इससे?
थैंक यू। आज जिस मौके पे मैं आयुष्मान भारत डिजिटल मिशन और आयुष्मान भारत जो पीएमजे योजना है, इस दोनों के बारे में थोड़ा बेसिक्स बता दूं। अभी मैं पिछले पैनल को भी सुन रहा था। जो मेजर चैलेंज इंडियन हेल्थ केयर सिस्टम का है, वो सबसे बड़ा है फ्रेगमेंटेशन, अनस्ट्रक्चर्ड डेटा एंड डेटा लाइंग इन साइलोस। अगर हम इस 3 चीज़ को देखें तो आयुष्मान भारत डिजिटल मिशन के पहले जो स्थिति है उसके अनुसार आप एक हॉस्पिटल में अपने इलाज के लिए जाएंगे, आपका डेटा उसी हॉस्पिटल में रह जाता है। दूसरे हॉस्पिटल में 6 महीने बाद, साल भर बाद कभी जाएंगे तो वहाँ फिर दूसरा डेटा रह जाता है, और दोनों के बीच में कोई रिलेशन ही नहीं रह पाता है, बिकॉज वो हमारी जिम्मेवारी बन जाती है कि कैसे हम एक हेल्थ रिकॉर्ड को कैरी करते रहें, प्रिजर्व करते रहें और दूसरे हॉस्पिटल तक पहुँचाएँ। और ये 6 महीने, साल भर की बात हो तब तो चल सकता है, बट ये 10 साल, 20 साल, 30 साल और रादर पूरे लाइफ टाइम की ज़रूरत है, राइट फ्रॉम द बर्थ टिल यू अचीव योर लास्ट पार्ट ऑफ योर लाइफ. So this whole journey is highly fragmented and it doesn't serve the citizen or the patient in a full form which we expect. Ayushman Bharat Digital Mission, which was actually launched in September 2021 and we have recently completed 4 years, actually has created a big technology backbone on which all healthcare system can actually work together, talk to each other, share record between them, and actually empower the citizens to hold his whole health history with himself. तो ये आयुष्मान भारत डिजिटल मिशन में it is happening because we have created a patient identifier registry in form of Abha ID, and almost 84 crore citizen of this country has got Abha ID. Second is health facility registry, which has got around more than 4 lakh health facilities registered, verified. So if you are on registry, it can be especially said that it is a verified, uniquely identified health facility, which may be hospital, which may be lab, which may be pharmacies. Similarly, health professional registry, which makes sure that every professional is identified and verified. Today, in telemedicine, if you are communicating with a doctor, you are not very sure on the other side whether he is a doctor or not a doctor. So by being on health professional registry and getting identified, it is ensured that the doctor or the nurse or the paramedics or allied health professional is actually genuine and verified. So this is the backbone which we have created. On this backbone, this National Health Information Exchange actually works, by which a patient can share records with his consent across the facilities. So what happens today, if a newborn takes a birth, what do? You get vaccinated, and then it starts the journey. Every time he or she gets any medication, it gets recorded. So now you have an interoperable system in which whole health history can be kept at one place, and it is with the person himself. Though the data lies actually with the hospitals separately, but it is identified against a person or the patient who is actually connecting all the data lying across the facilities.
Right.
So
Sir,
this
तो
is something
एक
very
seamless connection आप लोग यहाँ पर
Yes.
बना रहे हैं, लेकिन बनवाल सर, इसमें एक इशू मुझे जो समझ में आ रहा है, आप मैमोथ डेटा को जोड़ रहे हैं एक साथ, बढ़िया काम है, लेकिन डेटा जब आप इतना इंसान का आप लोगों के पास है तो प्रिवेसी को लेकर के ये आप कैसे इंश्योर करेंगे? ये एक भय तो रहेगा ना मेरे मन में कि मेरा इतना सारा डेटा आपके पास है और जिस तरह के हम साइबर अटैक्स देख रहे हैं, उसको उस प्रिवेसी को इंश्योर करने के लिए नेशनल हेल्थ अथॉरिटी क्या कर रही है?
बाय द वे, एक चीज़ इसमें बिल्कुल क्लैरिटी से बता दूं कि ये जो हमारा आयुष्मान भारत डिजिटल मिशन है, ये इसमें प्राइवेसी, सिक्योरिटी and accessibility is by design. So privacy goes by design. It is compliant with our DPDP Act and all the privacy guidelines. But much more than this, there is no central depository of data. So government doesn't keep any data. So where are the data? Data is actually with the hospital, and it is linked with the patient. So our role as NHA or as an agency running these registry and the platform is actually to facilitate exchange of data. तो आज मैं अगर एक हॉस्पिटल में गया, इलाज कराया, हमारा इलेक्ट्रॉनिक हेल्थ रिकॉर्ड बन गया, वो मैं उसको पुल करके अपने मोबाइल पे देख सकता हूँ कि हमें क्या मेडिकेशन मिला, क्या सिम्टम्स थे और क्या क्या ट्रीटमेंट लिया। फिर 6 महीने बाद जब मैं दूसरी जगह गया, वहाँ भी हॉस्पिटल मैनेजमेंट इंफॉर्मेशन सिस्टम ABDM से इंटीग्रेटेड है, वहाँ भी मैंने आभा आईडी डाला। वहाँ इलेक्ट्रॉनिक रिकॉर्ड जनरेशन के पहले दे विल आस्क at the time of consultation itself, do you have any previous history or do you want to share your previous history? आप बताएंगे हाँ हम कर सकते हैं, मैंने इसी का इलाज 6 महीने पहले कराया था. So they will raise this request. Request will actually come through our exchange to the patient, and patient will get that request on his mobile saying that whether he wants to share that data. Does he want to share the data of last 6 months or 1 year or 5 years or 10 years? He wants to share data of 1 previous hospital or 2 hospital or 10 hospital. It is all his choice, and it is a conscious choice he makes. Thereafter, it whatever choice he makes, then it activates the sending hospital that this request has come and been consented, and thereafter it is shared between 2 hospitals. It is not shared with us. Therefore, the whole concern of privacy is not there with the data itself. Still, the PHR application, this personal health record applications, or the HMIS, which gets integrated with ABDM, uske samay mein we make sure that it is compliant with DPDP. It is also actually complying all the security requirement of web application, and it also meets all security requirements, whatever the guidelines exist regarding the application. So we make sure, or rather doubly make sure, that any application which uses data, right now we are not very sure because they are not ABDM enabled. But once they come for ABDM enablement, we make sure that their application is security audited, their application complies with the privacy guidelines, and they make sure that their application has been actually fulfilling the security requirements. So that way, I think it is more to publicize that how such a privacy by design system has been built in this country. And I think India is one of the few countries which has built such guardrail much before we actually integrate all the health facilities and the providers.
सर, इसमें टेक्नोलॉजी बहुत अहम रोल प्ले करती है, क्योंकि आप इतने सारे डेटा को ला रहे हैं और आप मुझे कह रहे हैं कि आप बिल्कुल निश्चिंत रहिए, आपका डेटा सुरक्षित है, क्योंकि हम उसको वो भी इंश्योर करेंगे. तो इसमें केवल सरकार या फिर सरकार निजी पार्टनरशिप के तहत और ग्लोबल पार्टनरशिप के तहत इस पे काम कर रही है?
एक्चुअली दैट इज वेरी गुड क्वेश्चन. एक्चुअली हम लोगों ने कोई एप्लीकेशन नहीं बनाया, और रादर एक एप्लीकेशन अभी तक बनाया है, वो आभा ऐप बनाया है जो आभा आईडी जनरेट करने के लिए एक PHR एप्लीकेशन है। समथिंग लाइक आप समझ लीजिए कि जब UPI आया था तो सबसे पहले कौन सा एप्लीकेशन आया था? That was Bheem, which was a government application. But how many of you use Bheem? Hardly any. Because the platform was created by NPCI and we just made one use case of Bheem that this is possible. And thereafter it was open for all private enterprises to actually develop solutions and make it scalable. This is what is going to happen with the ABDM. In ABDM, actually we have built only the infrastructure. We are not building applications. Right now, there are more than 350 private applications. I think 75% of them are private, except NIC and CDAC applications. Most of them are private applications. They are actually running on our platform. So we have provided a digital public infrastructure on which many private enterprises will actually develop applications, and they are developing applications. Today you are using HMIS, which are ABDM enabled, developed by private enterprises. Today you are using personal health record application developed by private enterprises. So there is a huge scope for private enterprises, and we have created sandbox environment in which private application can be tested and integrated with the, our ABDM infrastructure so that it can actually work on a interoperable environment. So this is the powerful tool which we have developed for everyone to work on it. More than that, now we are opening it for many researchers to look at what more can be done for this. And I think we run also another big program, which is Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, where we are getting data, because we are providing health cover of 5 lakh rupees to about 12 crore families. Already we have around 11 crore patients treated. So when hospitals make claim on our platform, they actually claim with a identified ABHA ID, HFR registration. So we get a huge data which also have the patient treatment history. Now this is the data because government is the provider. Now we are actually building this data through anonymization for developing a population scale solution. Because our problem is not just the individual. Our problem is actually of a scale. So if really we want, and I think previous panel was also discussing that preventive health is a much important and necessary requirement than the secondary and tertiary care which we are providing. So how we will do that? To do that, we at a population scale, we need data to be analyzed to know what kind of disease is actually being treated. What are the profile and what is its geography? Which area has got which disease burden? So we can actually do disease mapping, disease profiling, and also with more and more technology like AI and other emerging technologies coming, actually we can do predictive healthcare. We can actually predict disease right based on the initial screening and symptoms. So this is what we will lead to continuum of care right from primary to tertiary. So today, if ASA worker goes for a screening, she doesn't distinguish between a person who is having fever and person who is having typhoid. She just treats like a simple fever. Or if somebody has a diabetic, at what level he or she need to be referred. Even a lot of other cases are just not categorized. So with more and more clinical decision support system, more AI triage which we can build in the solution based on the data which we have, actually we can make a lot of predictive healthcare and also the preventive healthcare. So this is the potential which we have. We have huge, federated data structure which is getting created through ABDM, though the data lies in the hospitals. But now we can have the tools which can be tested against this data by requesting the hospitals to share anonymized data for population level solution to be tested.
So basically analysis कर पाएंगे, analytic बना पाएंगे, उस data से आप समझ पाएंगे आगे क्या करना है. तो आगे क्या करना है? बनवाल सर, 2047 सबकी निगाहें टिकी हैं और आप क्या देख रहे हैं? नेशनल हेल्थ अथॉरिटी को आप कहाँ पहुँचते हुए और आपके आयुष्मान भारत डिजिटल मिशन को क्या आपको लग रहा है 2047 तक हमारे देश में सभी लोगों के पास एक आभा आईडी पहुँच चुका होगा?
Thank you. Actually, when we talk of Viksit Bharat, then it can only be if we have a healthy Bharat or Swasth Bharat.
Absolutely.
And that will happen if today's generation, which is going to be the most productive one in 2047, gets integrated intelligent healthcare. So if we can identify right at the beginning, the health requirement and connect it through his whole health history, actually we will be doing a huge service to the humanity, to the public health system in this country. So when I see 2047, actually I see a integrated intelligent healthcare system in India, which takes care of the longitudinal history of every individual, makes the data actually interoperable against a common standard data protocol, and actually makes people understand much before they contract the disease. So this is what can be thought of. It is already happening in some cases. Like AIMS Delhi has developed a clinical decision support system for diabetes and hypertension. So based on the symptoms, now a second tier, third tier hospitals, doctor can actually predict based on some of the symptoms that you are likely to get diabetes.
Predictive analysis.
Yes, predictive analysis is possible. So this is what we are looking at. We are looking at a system which becomes a model public health delivery system for whole world. If we can succeed at population scale in India, this will be a model for whole of the world's public health problems. And I know AI and other such emerging technology, the way it is transforming super specialties. You are getting huge support in robotics and other diagnostics. Here we see huge potential in changing the whole way our public health workers, frontline workers are delivering health care. They become much more capable. Our doctors becomes many times more capable to deliver health services using this digital health system. And so we are not getting into their clinical part of it. But through this system, actually we are enabling the whole health system to deliver more using technology.
बिल्कुल. So मुझे जो लगता है कि AI केवल एक टूल नहीं है, बल्कि एक कैटलिस्ट है और जिसका इस्तेमाल आप लोग बखूबी कर रहे हैं. सर, बहुत कुछ आप लोग कर रहे हैं और डेटा का इस्तेमाल, डेटा को सुरक्षित रखना, लेकिन सबसे बड़ी चुनौती आप क्या देख रहे हैं? वो मैं जानना चाहूँगी, क्योंकि कोशिशें तो जारी रहेंगी और उन चुनौतियों को ओवरकम भी आप करेंगे, पर सबसे बड़ी चुनौती क्या है अभी आपको लगता है?
जो नॉर्मली सभी नई टेक्नोलॉजी में होता है, आई थिंक बिगेस्ट चैलेंज जो हम देख रहे हैं और है भी, वो है ABDM का एडॉप्शन का. आज भी हमारे पास बहुत सारे हॉस्पिटल हैं which are using HMIS system which is not ABDM enabled. There are many doctors, nurses, they don't use their HPR identity for consultation. So this is something which is a big challenge, and rightly so, because the people are used to the legacy system. They are used to the way they were working. And I think the new system makes them to think differently, though it will be useful for them. But right initially, it will be always challenging to convince them, to make them aware that in long run you will be benefited, and not just you, the whole system benefits. So it is happening, but the speed can be increased by more and more communication, and I think your platform is one good way to communicate that ABDM is the infrastructure we have created. The healthcare delivery system, who is to use this system to build intelligent, integrated healthcare. So I think we'll meet this challenge, but everyone has to work together to make sure in such a diverse country with so much of diversity of region and language and many others, I think we will have to work together to make it happen. And if it happens, India will be one of the most advanced country in healthcare delivery in the world.
सर आपको बहुत सारी शुभकामनाएं, इतना बड़ा काम आप लोग कर रहे हैं, चुनौतियां तो होंगी, उसका सामना भी कर रहे हैं, रास्ते भी निकलेंगे, मुश्किलें भी होंगी, पर सुनील परमार जी बहुत शुक्रिया, आपने वक्त भी निकाला और इस खास बातचीत के लिए। सर की बातचीत का जो एक हिस्सा है जो मेरे साथ रहेगा वो ये कि 2047 तक अगर हम विकसित भारत की बात कर रहे हैं तो ये विकसित भारत तभी होगा जब ये हेल्दी भारत होगा। बहुत शुक्रिया सर, बहुत शुक्रिया।
All right. Thank you so much, Sunil Kumar Barnwal. Requesting you to please stay on stage. Photo op ke liye.
So Krishna, I'm back with you and had such an interesting conversation with Mr. Banwal. And we would like
requesting Mr. Barnwal to stay on stage now because quickly we have to move on to the next set of HR visionaries that we are celebrating, whose contributions reflect innovation, compassion, and a strong commitment to a workforce well-being, isn't it, Priyanka?
Absolutely. और मैं मंच पर चाहूंगी कुछ और लोगों को आमंत्रित करना बनवाल सर के साथ. Prasanna Raghav, Senior Vice President and Head Branded Content, to come on stage.
Actually, small change. We're going to invite Mr. Jacob Matthew, Network Coordinating Editor, TV9 Network. Huge round of applause for Mr. Jacob Matthew. We're going to invite Mr. Anurag Prasad, CEO and co-founder of Visit Health, to join the felicitation party so that we can get it underway. Let's begin with the first set of HR visionaries. I'm going to invite up on stage somebody who leads compensation and benefits at Hindalco, shaping structured performance-linked rewards and frameworks at scale. Ladies and gentlemen, please put your hands together for Mr. Anand Torvi, Head Compensation and Benefits at Hindalco.
A big round of applause for Anand Torvi, Head Compensation and Benefits at Hindalco. और हमारे अगले एचआर विजनरीज की तरफ हम बढ़ेंगे. बहुत मुबारकबाद आपको. ईशांत अग्रवाल, प्रेसिडेंट सीजे DARCL लॉजिस्टिक. मैं उन्हें आमंत्रित करना चाहूंगी. ये हैं हमारे एचआर विजनरीज. ईशांत अग्रवाल is a business and people leader driving growth, operational excellence and organizational capability in the logistics sector. A big round of applause for Ishant Agarwal.
All right, moving on, we are going to honor somebody, a group that is a leading name in India's renewable energy sector, driving sustainable growth, first of all, with a strong focus on people, well-being, and workplace health. Ladies and gentlemen, please put your hands together for the Avada Group, and requesting Mr. Amit Kumar Jain and Jyotsana Vasudevan to please come on stage to receive the token of appreciation on behalf of Avada. Ladies and gentlemen, huge round of applause for the Avada Group.
A big hand for वाडा ग्रुप. बहुत शुभकामनाएं आपको इस अवार्ड के लिए, अच्छे काम के लिए. और हमारे अगले HR विजनरीज हैं मुशर्रत हुसैन, हेड ह्यूमन रिसोर्स, सुजुकी. A big hand for Mr. Hussain. Mr. Hussain is a veteran HR leader with decades of experience of driving people, strategy, leadership development and workforce transformation. मुशर्रत हुसैन जी हैं हमारे अगले HR विजनरी.
Thank you, Mr. Musrat Hussain, for being a part of this evening and being a part of our panel discussion earlier in the evening as well. Great listening to you, Mr. Musrat Hussain. Thank you so much for being with us. And time now to recognize somebody who's recognized for the strong focus on people practices, workforce enablement, and operational excellence in healthcare services. Ladies and gentlemen, please put your hands together for R1 RCM, requesting Mr. Amit Lakhotia to receive the token of appreciation for R1 RCM. Huge round of applause from R1 RCM and Mr. Amit Lakhotia.
जोरदार तालियां R1 RCM के लिए, बढ़िया काम के लिए और अपने फोकस को पीपल पर रखने के लिए. बहुत बहुत शुभकामनाएं आपको. और हमारे अगले HR विजनरी का अवार्ड जा रहा है विप्रो टेक्नोलॉजीज को. मैं रिक्वेस्ट करूंगी मिस एंजल को कि वो आए और इस टोकन ऑफ अप्रिसिएशन को ऑन बिहाफ ऑफ विप्रो टेक्नोलॉजीज लें. A big round of applause. Wipro Technologies is being recognized for its sustained commitment to people-centric practices, scale, and organizational excellence.
Up next, I'm going to ask the gentleman to be ready. He leads total rewards strategy at Akzo Nobel. And he's been driving competitive and equitable compensation framework across the region. Ladies and gentlemen, please put your hands together for Mr. Kuldeep Singh, Head Total Rewards, India Subcontinent at Akzo Nobel. Big congratulations to Mr. Kuldeep Singh.
और अगले HR विजनरी जिनको आज हम सम्मानित करना चाहेंगे वो हैं डॉक्टर गिरधर ज्ञानी जी, डायरेक्टर जनरल AHPI. और मैं रिक्वेस्ट करना चाहूँगी डॉक्टर सुनील के क्षेत्रपाल जी, डिप्यूटी डायरेक्टर जनरल ऑफ AHPI, कि वो आकर इस सम्मान को ग्रहण करें डॉक्टर गिरधर ज्ञानी के बिहाफ में. A pioneering leader in India's healthcare ecosystem, Dr. Girdhar Gyani has played a transformative role in shaping quality, accreditation, and policy framework across hospitals and nationwide.
Okay, up next is a strategic people leader driving transformation, future of work initiatives and people-centric cultures at S&P Global. Ladies and gentlemen, please put your hands together for the Vice President People of S&P Global, Ms. Bhavna Batra. And with that, we thank Mr. Barnwal for taking time out to be with us and the entire presentation party, Jacob as well, all of you. Thank you so much for that. But we're not done, Priyanka ji, isn't it? We're not done. We have more HR visionaries to felicitate for the evening. And for the next set of felicitations, I'm going to invite a very special gentleman. He's a distinguished leader in India's healthcare and wellness ecosystem. and a former associate of the late Honorable Prime Minister Shri Atal Bihari Vajpayee ji. He currently serves as an advisor to the SME Chamber of India and is known for his contributions to strengthening health systems and people-centric initiatives. Now we invite Mr. Vinay Kumar on stage to felicitate the next set of HR visionaries. Mr. Vinay Kumar, requesting you to please come on stage. And of course, we're going to invite Mr. Prasanna Raghav, Senior Vice President and Head Branded Content, to come on stage as well. And Mr. Vinay Kumar ji as well to please come on stage.
साथ ही में शाश्वत त्रिपाठी जी से रिक्वेस्ट करूंगी, co-founder and CTO Visit Health, to join our distinguished guest on the stage. हाँ, शाश्वत जी को बोल दो.
Okay, so we have the felicitation party now. Let's quickly get on with the next set of HR visionaries. I'm going to first begin by requesting somebody who's a senior HR leader shaping people strategy, talent development, and organizational effectiveness at Axis Max Life. The next HR visionary is Mr. Gautam Rao, Senior Vice President, Human Resources at Axis Max Life Insurance. Huge round of applause for him. On behalf of Mr. Rao, I request Yudhishthir Naruka to please come on stage to receive our token of appreciation. Mr. Yudhishthir Naruka, huge round of applause for Axis Max Life Insurance and Gautam Rao.
जोरदार तालियां इस जीत के लिए और हम बढ़ते हैं अपने अगले एचआर विजनरीज की तरफ. जोरदार तालियां बजी ही नहीं. ओके, सो नेक्स्ट एचआर विजनरी जिनको हम आज सम्मानित करना चाहेंगे वो हैं अनुश्री सिंह, चीफ ह्यूमन रिसोर्स ऑफिसर, JSW. अनुश्री सिंह, Chief Human Resource Officer, JSW, and on behalf of Ms. Singh, I request Vartika ji to receive the token of appreciation. Anushri Singh leads HR at JSW, driving workforce transformation, leadership capability, and future-ready people practices. A big round of applause for Anushri Singh, and award is being received by Vartika.
Up next, we are honoring somebody who brings deep expertise in total rewards, designing innovative compensation and benefit strategies in global environments. The next HR visionary we're honoring is Altamash Vakil, Director Total Rewards at New Realm. And on behalf of Mr. Vakil, I request Sujay to please come on stage and receive the token of appreciation. Huge round of applause for Altamash Vakil, Director Total Rewards at New Realm.
Okay, so let's move on to our next HR visionary, Alok Shiopurkar. May I please invite Mr. Shiopurkar, Human Resource Manager, HDFC AMC, to come on stage. And on behalf of him, we have Anish Keskar, who is with us in one of the panel as well. So Anish, would like to request you to come and accept this HR Visionary award on behalf of Alok Shiopurkar. A big hand for Anish Keskar.
And for HDFC AMC and for all the work that they've been doing in health and wellness as far as their employees are concerned. Ladies and gentlemen, these are the examples that we hope other companies and other HR leaders follow. Thank you so much for being with us.
हमारे अगले एचआर विजनरी हैं पारुल भयाना मैकेंजी से, और पारुल भयाना जी के बिहाफ में मैं रिक्वेस्ट करूंगी ईशांत कॉल को कि वो आकर इस टोकन ऑफ अप्रिशिएशन को एक्सेप्ट करें. ईशांत कॉल फ्रॉम मैकेंजी पारुल भयाना जी के लिए ये अवार्ड ले रहे हैं. पारुल भयाना जी इज रिकग्नाइज्ड फॉर हर कंट्रीब्यूशन टू पीपल एडवाइजरी, ट्रांसफॉर्मेशन एंड इफेक्टिवनेस ऑफ ऑर्गेनाइजेशन. आई थिंक शी इज नॉट हियर विद अस. लेट्स मूव ऑन.
Okay, fair enough. Moving on.
Who?
Yeah, requesting the representative to please take the stage. Time now for the next HR visionary as well. With that, our next HR visionary is somebody who partners with business leaders across the Asia-Pacific region to drive talent strategy, engagement, and people outcomes. Ladies and gentlemen, please put your hands together for Ravina Jain, HR business partner for Asia-Pacific from Atlas. Huge round of applause for Ravina Jain.
सो वर्कप्लेस में बढ़िया एचआर के काम के लिए हम अगले विजनरी को अवार्ड देना चाहेंगे जो हैं एएमडी, और एएमडी कंपनी के बिहाफ में मैं रिक्वेस्ट करूंगी आलेख को आकर के इस अवार्ड को ग्रहण करें। एएमडी ग्लोबल लीडर है सेमीकंडक्टर इनोवेशन की दुनिया में और पीपल सेंट्रिक काम के लिए जानी जाती है। अ बिग राउंड ऑफ अप्लॉज फॉर एएमडी।
And finally, for the evening, the HR visionary that we are felicitating is somebody who leads infrastructure and facilities at Bandhan Life, ensuring operational excellence and employee experience as well. Ladies and gentlemen, please put your hands together for the AVP of Infrastructure and Facilities at Bandhan Life, Mr. Sanjay Suri. And with
Thank you so much. Thank you so much. A big round of applause for all the
HR visionaries for the night who have been over here. Thank you all of you for taking time. And thank you to the presentation party, Prasanna, Vinayji, and Shashwat for that final round of felicitations. And really, that's what this evening is all about.
Absolutely.
Priyanka, getting all these people into one room, people who've been doing such good work, you know, and then making them have a conversation.
So Krishna, all of us, you and I work in the same organization.
Yeah.
How many times have we gone to our HR and told them that you're doing a good job?
I do it very often, to be honest, actually.
I'm going to check with the HR now. So Krishna का कहना है कि वो जाते हैं और बोलते हैं, पर मुझे लगता है कि हम चूक जाते हैं।
ज्यादातर के लोग नहीं करते हैं, अगर आप ये पॉइंट बनाना चाहते हैं तो।
मैं यही पॉइंट बोलना चाहती हूँ कि हम शायद उनके पास अपनी शिकायतें लेके बहुत जाते हैं कि ये नहीं हुआ, वो नहीं हुआ, ऐसे नहीं हुआ, और जब वो काम हो जाता है तो कितने लोग हैं जो थैंक यू बोलने चाहते हैं।
ये तो प्रॉब्लम तो एचआर और भगवान के लिए सेम है। हम सिर्फ भगवान के पास शिकायतें लेके जाते हैं, कभी थैंक यू करना भूल जाते हैं। एचआर भी कुछ वैसा ही है।
लेकिन आज हम थैंक यू कह रहे हैं अपने भी एचआर को, और यहाँ पर जो इतना एग्जाम्पलरी काम करने वाले लोग हमारे साथ इस एक कमरे में जुटे हैं, थैंक यू सो मच। और आप लोगों की वजह से हमें लगता है कि हमारे वर्क फोर्सेस में हम इनोवेशन देख रहे हैं, हम वेलबींग की अब बात कर रहे हैं। हम केवल ये नहीं बात कर रहे हैं कि इंश्योरेंस आपके पास होना चाहिए, पर हम बात कर रहे हैं कि मेंटल वेलबींग भी बहुत जरूरी है।
एंड ऑल्सो व्हाट इज इंपॉर्टेंट फॉर द इवनिंग इज दैट हम बात करें इसके ऊपर। जितना बात करेंगे उतना ही सॉल्यूशंस हम निकाल पाएंगे एट एन ऑर्गेनाइजेशनल लेवल, एट अ टीम लेवल, एट अ कंट्री लेवल, एट अ गवर्नेंस एंड पॉलिसी लेवल। द मोर वी टॉक एंड वी अंडरस्टैंड, you know, and for that we have to have one more very important conversation.
Absolutely.
One important conversation on that one all important word. It's called stress. So requesting all of you to settle down and start taking your seats, because the next conversation is a very important one. It's all about stress, isn't it?
The wellness loop, breaking the stress cycle at work, and Krishna is going to be talking, so I'm all ears. वक्त है हमारे अगले पैनल डिस्कशन का, जिसे कृष्णा मॉडरेट करने वाले हैं। और कृष्णा, मैं आपसे कहूंगी प्लीज सेंटर स्टेज लीजिए और अपने पैनलिस्ट को बुलाइए, और आप सभी से अनुरोध करूंगी कि अपनी जगह ले लें प्लीज। और ये बातचीत बहुत जरूरी है, क्योंकि होता क्या है, स्ट्रेस की बात हम सब कर रहे हैं। स्ट्रेस लेवल बढ़ गया है, ऑफिस जाने का, ऑफिस से घर जाने का, घर से वापस ऑफिस आने का, और हमारे आसपास स्ट्रेस बहुत ज्यादा है। और अगर आप दिल्ली एनसीआर में हैं तो पोल्यूशन का भी स्ट्रेस है। तो इन सब को मिला करके आप इस स्ट्रेस साइकिल को कैसे ब्रेक करें, तो इस इंटरेस्टिंग चर्चा पे आगे बढ़ते हैं. कृष्णा, over to you. Stage is all yours.
All right, so I think it's easy to set the context for this particular discussion because, we all are going through it. Many of us went through it before reaching over here. Traffic stress, work stress. So we're living in a world where stress and that dreaded word burnout and other chronic illnesses and emotional fatigue have become the reality, the norm, widespread across regions, across organizations. So in this panel discussion, what we're trying to decode really is that wellness loop, how stress leads to burnout. Burnout leads to illness, and illness eventually impacts productivity. So we need solutions. We need to explore what the solutions are, including preventive care, mental well-being support, EAPs, and data-led wellness strategies. So much has been spoken about it for the evening already. These data-led wellness strategies that help organizations break this wellness loop and build healthier work cultures. And for that, we have a very special set of panelists. I'm going to invite Mr. Ganesh Jadhav, HR Senior Director of Physics Wala. Huge round of applause for Mr. Ganesh Jadhav. We have Jyotsana Vasudevan, Senior Vice President HR of Avada Electro. Huge round of applause for Jyotsana Vasudevan. We have Ms. Raksha Agarwal, Global Head Total Rewards at Maruti Suzuki India, joining us. Thank you so much for taking time out to be with us over here. And we also have Salil Lal, CHRO, Maruti Suzuki. We don't have Salil Lal. Okay, we'll go with the panelists that we have on stage. Thank you so much for taking time out to be with us over here, being a part of this evening. I'm sure the conversations has been nothing short of interesting because, finally we're talking about things which wasn't spoken about a few years ago, and we're just at the beginning of it all, isn't it, Jyotsana? We have a long way to go. And if we have a long way to go, we need to understand this word called stress. Because if you have everything right, you eat right, you sleep right, you work out right, you have the right everything. But if you just add stress to it and the whole thing collapses, isn't it? And stress and burnout is not an isolated cases anymore. This is just, this is just a reality that everybody is dealing with at different levels, at varying levels, isn't it?
I'm a little stressed out right now because it looks like the three of us are in between cocktails and dinner and the rest of the audience here. So we need to break that stress a little bit, isn't it?
Okay. Let me just also go to Raksha Agarwal, Global Head Total Rewards and Acuity Knowledge Partners. Raksha, I'm going to ask you a very simple question. How do you do it in your company? How do you do it in terms of dealing with stress? Because how do you do it at an individual level? And how do you ensure that you're able to do that at a company level?
Thank you, and looking forward to this one. So in our company at an individual level, first we need to recognize the kind of stress that we go through lives. So stress, first of all, is if you're not being able to be present physically and mentally when you are doing a thing and you are constantly thinking, I have to do this next. Like for example, most of us must be thinking once we step out, we have to go and post on LinkedIn because that's what is expected of us, and if we don't do it, it becomes stressful, or we have to go home and work or do X, Y, Z. So that's become stress of life. What has happened nowadays is that we were used to professional stress for a very long time because 90s, you have to succeed, you have to be there, you have to grow up the career ladder. We have tackled the professional stress and we know how to work around it. Personal stress with family situations, with relationship, with friends, with expectations from the society is something again we have got used to over a period of time, and we know where to set our boundaries, what to do, what not to do around it. There is something new which nowadays, I wouldn't say nowadays, but 2000s is, the year of 2000 is looking at digital stress. To just be there digitally, always present, not being able to cut ourselves off social media.
And that tends to increase stress. The more you look at Instagram, the more stressed some people become.
Yeah, and digital stress is always there. Be it if you're working professionally, you have to put it up, seek for external validation, be there in LinkedIn, be there in social media, be there in forums like this, and then put up a post. That's a digital stress. If you are a personal life, you have to be there in Instagram, posted, be on WhatsApp, connected to friends, again adding to digital stress.
I forgot, LinkedIn also sometimes gives stress. You see somebody saying the fact that, they've got the best position. Oh, hey, I'm taking up this new position. Look at it, you get stressed. Why am I not getting that position? Isn't it, Mr. Ganesh Jadhav, talk to us, physics is a very stressful subject, back in school. I remember the 9th grade CBSE physics was absolutely, mind-boggling. But tell us, organizationally, there is to be cognizance that stress is something that's not visible from outside. Somebody could be going through stress and burnout, and they're just showing up at work, clocking their hours and going back, isn't it? And you can't let it go on forever like that.
So, just to inform all the audience, हम लोग सिर्फ physics नहीं पढ़ाते. So we are in all categories of education. So about the organization, we are almost reaching around 104 million subscribers via our YouTube channels. Around 45 million plus app downloads we have. So we have a huge student fraternity and 18,000 plus employees who are addressing this entire huge population of students. So when dealing with stress, what I fundamentally feel that then when there is a work pressure, everywhere there is a work pressure, but it should not convert into stress. सबसे बड़ा important factor which converts this work pressure to stress is the environment where you are operating. If you have a conducive environment where you have a flexible policies, let's say if you have a flexi shift, as Priyanka mentioned that we have to drive now to the office, that is another stress. So work is center and rest of the things are around this. So it builds the stress. So if you have a policy which says that you have to clock in at 10, otherwise आपका half day लगेगा. तो आप घर से निकलते ही आपका stress रहेगा कि I need to reach by 10. So how you can break that? So we have to have that flexibility in the operations where we should be able to say that, boss, you can come at any time, provided you complete your work and go. We just want that, and that will give them comfort to reduce that stress by मुझे आने का stress नहीं है.
Okay, Jyotsna, physics wala you can do that. Not all organizations can do that, correct? So every organization needs to find its own unique solutions to ensure that their employees are not stressed and burnt out, isn't it? And that's going to be step number one for well-being of the employees, isn't it?
Absolutely. So both the friends here have said a few things which has invoked a few reflections. Firstly, just by way of introduction, I spent the first half of part of my career in an American FMCG company, which was Whirlpool. And I think I met Sunil there. I don't see him right now here. Then I spent the next 17 years in a European employer, which is Shell, again, an oil and gas company, more than 100 years. In the last 6 months, I've been spending in the renewable energy sector here at Avada, which is an Indian promoter organization. So I feel that I've seen, when I was coming down here, I jotted 5 reflections, which I think is very pertinent to the stress cycle. But before that, let me ask all of you, you've all heard the term CTC, right? What is CTC? Bolo na yaar. Cost to the company, right? Have you heard the term CTW?
Cost to work.
No, you may not have heard of, in this context.
I was just taking a shot.
Good guessing though. I coined this term cost to wellness, right? Okay. And the cost to wellness is not what an employer is asking of a candidate or a future employee. It is what an employee should ask of their future employer. If I join this company, if I sign up for this assignment, what is it going to cost my wellness? Right? And I have made so many career choices simply because I would be paid double of what I'm making right now. But is that what I really want to do? How is it going to impact my wellness, right? So on that note, maybe 5 reflections. First one, you mentioned it. Just like motivation, wellness and stressors are very, very person-specific, okay? What stresses me may not stress you. You just mentioned about driving. Actually, driving for me is a de-stressor. I love driving to work. When I got a work from home assignment which was extended, for a few years I was managing multiple countries, my wellness took a nosedive. Because that constant sitting, working around the global clock, was not healthy at all for me. So that's point number one. So it's very tailored. Second, manager or leaders as your wellness agents. You'll all agree that your happiness at work, your wellness at work, your stress levels at work is not often because of how much work you're doing. It's because of who you are working for. What is the team that you're surrounded by? So they are really your wellness agents who make or break your wellness cycle at work. Third thing is role of communities. So at my life stage and my, my tribe really is my 6:15 a.m. tribe. So every morning 6:15 a.m., me and a bunch of other ladies who are, everybody is between 45 and 55, some of them 60, we all go out for our strength training. So there is a real motivation for me to get up because my tribe and my community is doing that. And we form those communities at work, right? Which is a real, it's not HR pushing this agenda. Fourth point is about education and communication. In my last organization, where I spent 17 years, there was so much proactive communication around health, wellness, every life stage, parents, senior women, and irony is, I'm married to a surgeon, and when I've been scaling my perimenopausal years, the kind of physical and emotional changes that I'm going through, it wasn't my spouse who actually helped me navigate it, it was my work network, which spoke about this kind of anxiety is triggered because of your hormonal changes, not because you have general anxiety disorder, right? So that's what education did to me because I recognized that symptom because I heard about that at my work group. And last thing is breaking the taboos. We heard so many panels talk about EAP. Can I ask you an honest question? How many of you have actually availed the EAP at work? I have. I did it because I wanted to make a statement also to my team when I was going through a stressful experience. I wanted to experience what an average employee who we believe as HR, हमने EAP को sign up कर दिया, but what is that service feeling like for an average employee? And I have to say I was contented after that counseling session because it really helped me anchor back. So these are 4-5 reflections which I want to pause right now on, which I think directly contributes or takes away the stress from your work life.
Raksha, that's a very important point, isn't it? You have this set of benefits that you're giving out to employees. It's important to do a sort of a taste check of it, yourself, isn't it?
Yeah, definitely. Not only a test check, as rightly said, as leaders, we have to say that we use it, we do it, and therefore, it is okay if you want that kind of a service. It is perfectly fine to be in that state. All of us go through it. So adding to it, what we also do 1 month in a year, where our leaders make a video of the stress which they are going through their life or the times when they have been in stress.
Wow,
that's innovative. Be it divorce, be it financial stress, be it stress around children. And they quote their case and they say this is what they did about it. How did they detox? What are the boundaries which they set for themselves? What are the education they seeked? What are the groups they went for support? So to remove this taboo around stress. Stress is something, it is real in our life, it can happen to anyone, and unless and until we talk about it, do something about it, we will not be able to solve it. So we propagate that agenda very, very actively within the company.
Ganesh, in that sense, you have a stress social media, so to speak, where you sort of discuss, what kind of stress you're going through and how you're dealing with it. And that becomes a simple way to understand how to go about doing it. People at elevated positions in the organizations, when you see them going through it, first of all, you don't feel alone, that I'm the one stressed out, everybody is stressed out, but look at the way they are dealing with it. That kind of simple examples, deal with the problem more than any other complex solutions, isn't it?
Yeah, so when you go up the ladder, the span, the zone get increased, the responsibilities get increased. But at the same time, it's an ecosystem, again I will say that, in which ecosystem you are operating. So if you have a supportive management, if you have supporting founders, if you are supporting reportees, if you are supporting colleagues, it doesn't matter at what level you are operating, at what span or zone you are operating. It helps you to carry out all those responsibilities with ease and with comfort. So the peers with we are operating is very important while dealing with the stress at the level.
Absolutely, very important, and hopefully this conversation helps organizations and companies understand how they need to go about it. But I'm going to wrap things up because we're completely out of time over here. We are standing between you and dinner, so I don't want to, without any further ado, huge round of applause for the panelists who have taken time out to help us understand about stress. That is going to be the crowning achievement for wellness going forward. Thank you so much for being with us. Before we leave you from the stage, quick photo opportunity and then we can get on with it.
Thank you so much, panelists, for your precious time and your thoughts that you shared with us. Thank you, Krishna, for this wonderful chat on stress. Are we feeling a little de-stressed now?
I mean, I'm hoping that we will all end up feeling more de-stressed in our workplaces. There's so much talk of toxic workplaces these days. It's important that we remove that toxicity. We have enough of it outside. In Delhi NCR, we have a great, wonderful toxic air that we all are breathing. So it's important that when we breathe all that toxic air, go to an office, there is no toxicity. That's the hope, because that is the #1 source of stress as far as I'm concerned. That has the capability to add stress to all other aspects of life, isn't it, Priyanka?
Absolutely,
Workplace
Krishna.
stress.
So we did try to, sort of understand what is going on, and बहुत अच्छा लगा आप लोगों से बात करके, आप लोगों के बीच में हमने समझा कैसे टेक्नोलॉजी, वेलनेस और ह्यूमन सेंट्रिक अप्रोच मिला करके ऑर्गेनाइजेशंस अपने आप को बदल रही हैं, सोच रही हैं, बहुत कुछ करने की कोशिश की जा रही है, और ये समिट सिर्फ विचारों का आदान प्रदान नहीं बल्कि बेहतर और इंक्लूसिव वर्कप्लेस बनाने की दिशा में मील का पत्थर साबित हो, हम यही उम्मीद करते हैं। थैंक यू सो मच हमारे इन डिस्कशन में आज आप लोग जुड़े, बहुत बहुत शुक्रिया आप सभी का।
That's right, ladies and gentlemen, huge round of applause for all those who've taken time out to be over here. With that, we are wrapping up this summit. I extend our heartfelt gratitude to all our dignitaries, speakers, partners, and delegates and our sponsors. Your presence has contributed immensely to our mission, really, at TV9 Network of building healthier, happier, future-ready workplaces. Thank you so much for making this evening wonderful. Requesting all of you to continue the conversations outside at the dinner. For now, it's a goodbye from my side. This is Krishna Kumar signing off, and
Priyanka Sama saying namaskar. Thank you so much.
And before you head out for dinner, one quick note. All those who won the awards for HR Visionaries for the night, requesting all of them to please come on stage for a quick photo opportunity. Requesting all HR Visionaries for the evening to please come on stage for a quick photo opportunity before we can head off for dinner. Requesting all of you to please come on, take the stage.